but as all the judges told, there are a lot of mistakes in the spellings and chief complaint also. You have written generalized swelling for last 15 days. What does it mean? What is your understanding regarding this?
Generalized swelling, ma'am.
You have written in your chief complaint. So what is your understanding? Why you have written generalized swelling for last 15 days?
मैम रिकरेंट फीवर ऑन एंड ऑफ फीवर तो इन्फेक्शन हो रहा था तो इसलिए मैम जनरलाइज स्वेलिंग भी
You have written, so just I am asking why you have written generalized swelling for last. What are other differential for generalized swelling?
okay.
Why the patient of MBBS develop generalized swelling? Okay, no problem. So read it.
Good afternoon, respectable teachers and my dear colleagues. I am Abhishek Kumar and I am going to present a case of anterior gastric wall perforation following blunt abdominal trauma in a pediatric patient. Blunt abdominal trauma usually causes solid abdominal organ injuries like the liver, spleen, kidneys, whereas hollow organs like the stomach and the intestines are damaged as a result of perforating abdominal trauma. Less than 2% of gastric wall perforation occur due to blunt abdominal trauma. 75% cases of gastric wall perforation are due to road traffic accident, but in our case it was due to fall from height. The major mechanism postulated for damage for causing gastric wall perforation following blunt abdominal trauma is a sudden and massive increase in intraluminal pressure of the stomach, which might be due to a road traffic accident or fall from height, which was our case. A 12-year-old male arrives to our emergency department with an alleged history of fall from tree. The patient's airway was patent. He had difficulty breathing with pain in the chest and the abdomen. His oxygen saturation was 90%, for which he was given oxygen at the rate of 1 to 2 liters per minute. Chest auscultation revealed decreased air entry and crepitus on the right side, suggesting subcutaneous emphysema, which was confirmed on the chest X-ray. External hemorrhage was absent, pulse was rapid and feeble. His blood pressure was 80 by 50 millimeters of mercury. He was oriented to time, place and person with a GCS score of 15. Abdominal examination revealed rigidity and tenderness over the abdomen. Fast was suggestive of hemoperitoneum. An exploratory laparotomy confirmed a 3 centimeter long, full thickness gastric wall perforation along the anterior wall of the stomach. Note that only 40% cases of gastric wall perforation occur along the anterior wall of the stomach, which was our case as well. Here is a picture of it. The differential diagnosis to blunt abdominal trauma include solid abdominal organ injuries like to the liver, spleen, kidney, and the aorta. We ruled out this differential diagnosis via an exploratory laparotomy. And what indicated an exploratory laparotomy in our case is up to date, a database based on evidence-based medicine suggests that when a pediatric patient with blunt abdominal trauma presents with hemodynamic instability, we transfuse him blood or fresh frozen plasma. And if the patient responds to the blood transfusion, we manage him conservatively. But in our case, if the patient does not respond to blood transfusion, an exploratory laparotomy is indicated, which we performed in our case. Management of our patient included relieving his subcutaneous emphysema via an intercostal drainage. 2 units of packed red blood cells and fresh frozen plasma were transfused. Peritoneal lavage was done with warm, normal saline. Exploratory laparotomy was done. Primary repair of the gastric perforation was done via omental patching. 2 abdominal drains were placed, one in the pelvis and another in the subhepatic region. Sterile dressing was done and the patient was shifted to the post-operative ward. A nasogastric tube was placed to prevent post-operative gastric decompression. A Foley's catheter was placed. Antibiotics and analgesics were administered. Conclusion of our case is that gastric perforation following blunt abdominal trauma is rare, and stomach injuries have the highest fatality rate among all hollow organs. The mortality rate increases with the length of the operative intervention. Intervention within 8 hours is linked to a mortality rate of 2%, intervention between 8 and 24 hours to a mortality rate of 17%, and intervention beyond 24 hours to a mortality rate of 30%. In our case, the operative intervention was performed after 72 hours of the injury and the patient had an uneventful recovery. Thank you.
So Shubham, very well presented. Your presentation was very nice and you spoken very well. So one thing I would like to ask from you, what is the mechanism of subcutaneous emphysema in your patients? And where you have decided you have to put intercostal tube drainage in the right side or left side in the chest?
Ma'am, we did a chest X-ray for that.
So what is the reason?
And while auscultation, the crepitus was present only on the right side and not on the left.
No, my first question is, what is the mechanism for subcutaneous emphysema in your patients? Why this patient developed subcutaneous emphysema?
Ma'am, the blunt abdominal trauma possibly damaged the pleura and the lung alveoli, which led to escape of air into the pleural cavity.
So, partially right, I would like to explain here. When the pleura ruptures, it will cause pneumothorax. When the alveoli ruptures, it will cause pneumomediastinum. Okay, so it can leave. This patient develop pneumomediastinum. On basis of this, patient develops subcutaneous emphysema. The rupture of alveoli due to the pressure injuries or due to the blunt injury trauma, this patient develops subcutaneous emphysema. So how will you decide to put a ICD in this patient on the right or left if this patient doesn't have a pneumothorax? Okay, let it be. But your presentation was really nice.
Thank you, ma'am.
Hi Abhishek. Abhishek, this was a wonderful presentation. And since I'm from a medicine side, so surgery mein to apna sab kuch hila hai na? So I'll just ask, just tell me what are the non-surgical causes of anterior wall gastric perforation?
Non-surgical causes for anterior gastric wall perforation.
Yes, anterior wall.
Ulcer.
What kind
Gastric
of ulcer?
ulcer.
Okay, gastric ulcer and
Malignancy.
what kind of malignancy?
So gastric adenocarcinoma of signet ring type erodes into the gastric mucosa wall.
Okay, in a 12-year-old child?
And
No, in a 12-year-old child?
no, sir, not unlikely. Ischemic injury to the gastric wall mucosa. For example, if he overdosed on aspirin, he could bleed. And
See, aspirin will actually be causing bleeding, right?
Yes, sir.
If you're talking about ischemia, it has to be something vasculated, right? If there is underlying vasculitis, if there is any autoimmune condition that leads to vasculitis, there of course there can be ischemia, which can later on of course result in perforation. Okay, thank you.
Abhishek, very nice presentation.
thank you, sir.
I would like to ask two questions.
Yes, sir.
First is in addition to what Dr. Jyoti asked, your patient developed emphysema. Any patient with blunt injury abdomen coming to you in your surgical emergency department, and you see a emphysema in that patient. So what do you expect to कि मैडम ने जैसे बताया कि alveoli से आ रहा है and the patient is not having pneumothorax. What do you expect to see on clinical examination? What could have led to this emphysema?
Hypoxemia.
No. Clinical examination में आपको क्या मिलेगा? Clinical while palpating, you are clinical examining the patient from head to toe, है ना? So what do you expect to see? What could have led to this change? What could have led to this emphysema? Emphysema कैसे बना होगा? वहाँ पे blunt injury हुआ patient को, blunt injury abdomen में हुआ and simultaneously chest में हुआ. तो clinical examination पे chest में important finding क्या मिल सकती है? While palpating, very important. Crepitus. What kind of crepitus? One crepitus is due to the emphysema. You can get a bony crepitus, a rib fracture. The blunt trauma in chest, most common cause rib fracture. So rib fracture would have penetrated the pleura as well as the lung, जो कि जिसकी वजह से emphysema होता है. ठीक है? And on the while examination, you examine कि जिस side rib fracture है, उसी side हम लोग ICD करते हैं. Okay? That you confirm on the X-ray also. Anyways, my second question is, you saw a visceral organ injury on laparotomy. Gastric perforation was there. This is a rare case, you only said. Then just tell me, what is the most common visceral organ injury on blunt of the abdomen, blunt injury of the abdomen?
Liver.
Visceral organ, I'm asking.
Organ.
Liver is the most common organ in the injury. Among the visceral organs, viscera में कौन सा होता है? Hollow viscera.
Intestine.
Intestine तो बहुत बड़ी है. Stomach is also part of that. Which part of the duodenum, ileum, colon? No, it is duodenum. Anyways, nice presentation.
Thank you, sir.
You.
Congratulations, Abhishek.
Thank you.
Very nice presentation, very well presented. I would like to hear post-operative management of your 12-year child. What did you do post-operatively with child?
Ma'am, post-operatively, a nasogastric tube was placed to prevent post-operative gastric decompression, and antibiotics and analgesics were administered. Sterile dressing was done, which was changed every day. His vitals were monitored every day until he had an eventful recovery.
So after how many days your baby was discharged?
Our patient was discharged almost after 2 weeks.
Okay, good.
Abhishek, very well presented, very eloquently spoken, and I must congratulate you because you did a thorough literature review of your patient. Only one clinical question. You said there was decreased air entry on the
Right side.
right side. So clinically, based on your respiratory system examination, how will you say it was a fluid or a air?
A CT should inform us of that.
Just on examination, can you say is it air or is it fluid?
If it were fluid, in that case, ma'am, air would sound as resonant on auscultation, but fluid will not.
Percussion you want to say?
Yes, ma'am?
You want to say percussion or auscultation?
Ma'am, percussion.
Okay. So in this case, because there was decreased air entry on your auscultation, and it was, would you wait for imaging to come, or would you put an ICD?
We will not wait for imaging to arrive.
Right. You can put an ICD because it's an emergency.
Yes,
You need to decompress, otherwise the child will land into arrest or something. Okay. Thank you. Very well.
Thank you, teachers.
Student, KGMU. Good morning to everyone present here. I am Gunjan Parashar and I'll be presenting a rare case, primary intra-abdominal synovial sarcoma with delayed presentation. Synovial sarcoma is a soft tissue sarcoma. It accounts for 2.5 to 10.5% of all primary malignant soft tissue neoplasms. Most common age group is mainly seen in after fourth decade of life, but 1/3 are seen in less than 20 years of age. Most common site is extremities, but if it is found in the abdomen, it is mainly found in the retroperitoneal region. In our case, it is intra-abdominal. That is why it is a rare case. Metastasis is seen in 50% of cases, and it has a pathognomic chromosomal translocation between X and 18. So we had patient X, a 15-year-old female, who presented to our surgical emergency department with chief complaints of respiratory distress since 2 days and abdominal distension, pain, abdomen, and recurrent vomiting for 10 days. When we took the history, it showed, we were informed that they had insidious progressive growth of mass in the right abdomen for past 6 months and rapid progression in size for 2 months. There was a history of significant weight loss over a period of 6 months. Symptomatic treatment received from the local practitioner provided relief from the pain that was caused by the mass. There was no history of fever, jaundice, hematemesis, melena, ATT intake, or any previous surgery. When we examined the patient appeared pale, weak. The patient was severely malnourished. She was in respiratory distress with tachycardia and increased respiratory rate. A 15 by 20 centimeter lump was palpable involving the right hypochondrium, epigastrium, right lumbar region, umbilicus, and right iliac fossa. Lump was firm to hard in consistency. It was slightly mobile side to side. It was dull on percussion and shifting dullness was absent. The patient had already received a USG guided FNSC in GSPM Kanpur. FNSC in GSPM Kanpur, which was suggestive of carcinoid neuroendocrine tumor. Then she was referred to KGMU. Here, a USG guided FNSC was again performed, which was suggestive of GIST or a mesenchymal origin mass or a neuroendocrine tumor. Chest CT showed no metastasis to lungs. A CCT abdomen showed heterogeneous solid cystic mass extending from the epigastrium to pelvis, compressing the stomach and liver with maintained fat planes. The differential diagnosis we formed were GIST, neuroendocrine tumor, Ewing sarcoma, and ovarian tumors. Since the patient was in respiratory distress, we managed the patient, we stabilized the patient by giving, and the patient was also malnourished, so we stabilized the patient by giving, parenteral nutrition and oxygen therapy. When the patient was stabilized after 2 days, we did an exploratory laparotomy, and on exploratory laparotomy, we saw a large cystic lump extending from the epigastrium to the pelvis that was causing the gastric outlet obstruction, because of which the patient came with complaints of recurrent vomiting and respiratory exacerbations. The patient also had multiple omental nodules and peritoneal deposits. So we did excision of lump with radical omentectomy with peritonectomy under general anesthesia with left ICD placement. The patient was then shifted to ICU, and after 2 days of uneventful post-operative recovery, the patient was advised for chemotherapy under medical oncology department. The final HP report came out to be synovial sarcoma, FNC LCC grade 3 with IHC positive for Vimentin, BCL2, SMA, CD99 and CD56 positive, and negative for CD34, CD117, chromogranin and synaptophysin. This HP report clearly stated that the patient was suffering from synovial sarcoma. The take-home message from this case is that primary intraperitoneal synovial sarcoma is rare. Surgery remains the mainstay, but we have to individualize the treatment according to the patient and disease-related factors, because in this case, the patient came with acute exacerbation, so we could not wait for any histological report to come, and we had to perform the exploratory laparotomy. Early referral to tertiary care center will result in better prognosis and outcome as seen in this patient. Thank you.
Gunjan?
Thank you, ma'am.
I would like to ask why upfront surgery was not taken for your patient.
Ma'am, can you repeat the question?
Why upfront surgery? I mean hereby, like you said that FNAC was first done in your patient and then patient was taken for surgery. So why upfront surgery? Why first time surgery was not done? What was the indication of doing FNAC, and then you said that you didn't wait for histopath to come and you operated the patient?
So when the patient came, we performed the all the FNAC and biopsies we performed, and since after 2 days the patient was the respiratory distress of the patient was not relieved, that is why we had to take her for exploratory laparotomy.
That's what I want to ask. There is no indication such that you do FNAC and biopsy and then you decide that now I'm going to operate this patient. That never happens. Either you will be taking your patient first for surgery, and if you feel that this patient cannot be taken for surgery and we need to give chemo or something like that, then only you will do FNAC or biopsy for that patient. Okay?
Very well presented, Gunjan.
Thank you, ma'am.
I just wanted to ask you, how would a basic question? So, any lump, how would you elaborate it in the examination findings?
Ma'am,
headings?
Lump.
Any lump, how would you describe?
By location, by its appearance, how does it look. Then we'll try to find out what is the origin, the organ of origin of that lump. Then if it's tender, if it has any associated symptoms, pain or ulcer, or it's bleeding or not. Then the consistency of the lump, and what should I say? The dimensions of the lump, and any associated factors, any associated disease factors that it's causing. Like in this case, it was causing gastric outlet obstruction as well as respiratory distress.
These are the basics. So say shape, size, consistency, margins, borders, and the overlying skin, how does it look? So these are the basics.
Yes.
I just know the basics of surgery.
Thank you, ma'am.
Gunjan, very nicely presented. Could you just repeat your differentials? What all differential diagnosis you put in your case?
So my differentials included GIST, neuroendocrine tumor, Ewing sarcoma, and ovarian tumors.
Okay. What are your positive points whenever you say this is ovarian tumor? So what we expect to see in a ovarian tumor vis-a-vis compared what you saw in your case?
So in ovarian tumors, I would have seen some hormonal disturbances in the patient. But
In your clinical examination, whenever you are examining the abdomen, I am asking, whenever you are examining the abdomen and you are saying this could be, yes, this could be a ovarian tumor. Okay, so what are those peculiar features for ovarian tumor to come up in your clinical examination finding कि हाँ ये ovarian tumor के ही में ऐसा होता है, मेरे पेशेंट में ऐसा होता, तो इसलिए मुझे लगता है ये ovarian tumor होगा.
ma'am, sir, it was close to the pelvis, so the organ of origin might be some organ that is lying in the pelvis. That was my first thought. Then
But your presentation, I think it said it was in right hypochondrium swelling in upper abdomen.
So it came down till the pelvis.
Okay.
It involved the right iliac fossa, umbilicus, and till the right, up to the right hypochondrium. And the abdomen seemed totally full, so we could not tell कि कहाँ से वो कहाँ तक है. That mass was totally occupying the abdomen.
Okay. My second question is, how can you differentiate on your clinical examination whether it is retroperitoneal or intraperitoneal?
So retroperitoneal masses are not movable, first of all, and intraperitoneal masses are movable with respiration. Secondly,
Any other changes?
so
That's good.
Okay, good. This was a good presentation from your side. Just a simple question. What are the causes of distension of abdomen? One that you have already mentioned is one tumor that you have mentioned, intra-abdominal sarcoma.
So-
What can be the other causes?
causes of
Distension of abdomen.
distension of abdomen.
Yes, simple distension. Patient coming to you with distension of abdomen. What can be the possible causes?
So it might be a liver pathology.
Okay.
Then it might be a benign.
Did you know anything about 5 Fs? We used to read F, fat, fluid, fetus.
Yes,
That
sir.
is what I want to know. That what can be the causes of distension of abdomen. ये तो आपने अल्ट्रासाउंड कराया, आपको इतना हिस्ट्री पता चल गया, बायोप्सी कराया, FNAC कराया, है ना? And then you came out to know this thing that yes, it is this intra-abdominal sarcoma. But simply, अगर पहली बारी patient आ रहा है, how will you know that ये क्या है? You should know that yes, what are the 5 Fs, the causes of distension of abdomen.
Yes, sir.
Okay. The other thing is you mentioned in your differentials, you mentioned about neuroendocrine tumors and GIST. On the basis of immunobiochemistry, how do you differentiate it from that of intra-abdominal sarcoma?
So the patient was negative for synaptophysin and chromogranin, so
That rules out?
neuroendocrine tumors were ruled out.
Okay.
And CD34 was also negative. That ruled out GIST, which is found positive in 90% of GIST cases.
Okay, fine. My next question is, which is the most common site of metastasis?
So lungs.
Okay, fine.
Thank you, sir.
So Gunjan, you have presented very nicely. So I would like to comment one or two comments on your presentation. First of all, you have presented chief complaints. So your chief complaint should be in chronological order.
Yes, ma'am.
You have written patient has respiratory distress for last 2 days and other complaints last 6 months. So it should be in chronological.
Sorry, ma'am.
No, it's okay. This is just a learning. So you have to be in a chronological order. My second comment is you have mentioned that patient had respiratory distress. So what are the reasons for respiratory distress? And second thing, when you will define this patient has tachypnea. So what is definition on your point of view? When will you say this is tachypnea?
Ma'am, cause of respiratory distress in this patient or overall?
Just tell me overall.
Ma'am, causes of respiratory distress might be asthma. Asthma is the most common cause in children in this age group.
Okay.
Then pneumonia, any
Okay.
infective cause. Then such as in this case some abdominal mass that is compressing the air.
What is your understanding regarding respiratory distress? I am asking this.
Ma'am, breathlessness,
Okay, one
pain
point.
during breathing.
Okay, you are right. In halfway. So my second question is, what is tachypnea?
Ma'am, more than 22 per minute respiratory rate.
More than 20. Okay, so you are halfway. But okay, it was very nicely presented from your side. I am not a surgeon, I am just a physician, so this is my comment from my side. Okay, thank you.
Thank you.
Third year MBBS candidate.
Good morning everyone, I am Shreya Verma from King George's Medical University, Lucknow, and I am here to present a case titled An Unusual Repetitive Presentation of Hematoma in a Patient of Mild Hemophilia A with Post-Traumatic Proptosis. Now coming to the history, a 9-year-old boy presented with the alleged history of fall of brick over his head with impact over the left parietal eminence 9 days back. He complained of gradually progressive swelling of the left eyeball with protrusion, pain and diminution of vision. And there was a soft and fluctuant swelling over the left temporoparietal region, mostly a subgaleal hematoma. This is the post-traumatic day 1 photo. Now coming to the clinical examination, proptosis of the left eye with severe conjunctival edema with corneal opacification and the soft fluctuant swelling over the left fronto-temporoparietal region with tenderness over left orbital and zygomatic region. On ophthalmology examination, vision of the right eye was 6/6 and there was no perception of light in left eye. And this was the post-traumatic day 3 photo. And this is the post-traumatic day 9. Now coming to the possibilities. This could be a orbital cellulitis, this could be a rhabdomyosarcoma, this could be orbital hematoma. Now coming to the radiological examination, here you can appreciate on axial non-contrast CT scan, you can appreciate a subgaleal hematoma. On sagittal view also, you can appreciate subperitoneal hematoma. So after the clearance from the hematological department, we underwent left-sided frontotemporo or bitozygomatic craniotomy with evacuation of the left orbital plates, subperiosteal hematoma. This is the intraoperative picture. This is also intraoperative picture. This is now post-operative CT scan. Here you can see there was no blood, evacuation of subgaleal hematoma, evacuation of subperitoneal hematoma. There was no evidence of any residual hematoma in immediate post-op scan. Post-op course. The initial post-op course was uneventful. Blood products were transfused in post-op period. Proptosis gradually reduced for initial few days. But on post-operative day 7, he developed left-sided motor deficit with slurring of speech. A repeat non-CT scan of head of the patient revealed an extradural as well as the subdural hematoma below the operative site. Immediate plan for re-exploration was made and the left FTP craniotomy with evacuation of extradural hemorrhage and subdural hemorrhage was done. This is the intraoperative images. So, we underwent detailed hematological examination. The above complication of the surgery lead us to the detailed hematological workup with the help of Department of Clinical Hematology. And the final result came out to be mild hemophilia A. Now the current status of the patient is receiving factor 8 concentrate. The patient is recovering satisfactorily and proptosis is gradually settling. So take-home messages are, with an unusual presentation of proptosis following blunt trauma surgery, we must always search for coagulation abnormalities as early as possible. Plan the best possible management with minimal intervention if possible. The primary aim of the surgery should prevent visual loss followed by cosmesis. Thank you.
You did it very well. Thank you so much.
Thank you.
Shreya, very well presented with the good pictures and pre-op and post-op. So my question is, how did you get the day 1, day 2 pictures?
He took the photos himself.
Okay, and he presented to us on day 10.
Day 9, ma'am.
Day 9 with the
Yes, ma'am.
Okay. One question, what happened to the left-sided hemiparesis he had?
What, ma'am?
Left-sided hemiparesis he developed?
Yes, ma'am.
What happened to the hemiparesis? I mean, it was improving, it was static.
Ma'am, actually the vision was lost from the left eye,
right,
and hemiparesis was improved, basically.
That was the only question.
Shreya, very nicely presented.
Thank you, sir.
One question. You said he developed extradural hematoma that was confirmed on CT scan. How does the extradural hematoma look like on CT scan?
Sir, extradural hematoma have biconcave shadow.
Good. And what is the treatment for extradural hematoma?
Sir, evacuation is the treatment.
Is it an emergency, semi-emergency, or it can be done on an elective basis?
Sir, it is not an emergency.
Okay. Thank you.
Thank you, sir.
Okay, sure. Wonderful presentation. Can you tell me what is hemophilia A, B, and C?
So, deficiency of factor 8 is A, factor 9 is B, and 10 is C.
10 is C. Okay.
11 is C.
Right. Okay. And then what is von Willebrand disease and how do you differentiate it from that of hemophilia A?
So,
von Willebrand disease, VWD. Heard of it?
So, hemophilia A is a deficiency in factor 8, and so von Willebrand is.
Which disease is more common? Is hemophilia common or von Willebrand disease? Which is more
hemophilia.
Common? Hemophilia is more common. Which is the most common bleeding site in the patients of hemophilia? This so you have presentation that he had this ocular hematoma. Which is the most common site of bleeding in patients of hemophilia?
So after tooth extraction, maybe.
Most common tooth extraction, fine. It's fine. You say that there is bleeding. Which is the most common area where they bleed? most of the
So
time.
I'm not sure, but maybe nose bleeding.
No. Thank you.
Very well presented, Shreya. So I would like to ask one thing. What are the other causes of proptosis?
Ma'am, maybe there could be a tumor.
Okay.
Tumor. And sir, and ma'am, optics varices may be the reason.
Okay. And one more thing. Do you think there is some history is missing in this case? Why this case was not evaluated on the history basis? If the patient has hemophilia, any bleeding disorder, what is the most common history given by the patient, parents, or the patient itself?
Ma'am, the history of excessive bleeding, even in the minor injuries.
Yes. Did you ask in this case?
No, ma'am, this was missed. Yes.
So why this was missed? Because there are congenital 13 deficiencies also presented like this. The patient parents or sometimes the patient itself give a history by his relatives or any other members that when on a trivial trauma, patient non-stop bleeding will be there. So this history is very important because I have seen one case very important in my ward. The patient presented is a 13-year of age with tuberculosis and his parents given his umbilical cord was bleeding continuously when he was born, and he has history of bleeding. So when we suspect this is a case of hemophilia, so at the time of history important is very important.
Yes, ma'am.
This kind of cases. Okay, very well presented.
Thank
you.
you.
Okay, sure. Sure. Yeah. See, so the most common site where, because see, he's a younger patient, right? He's a young patient. So the bleeding into the joints is very common because we all know that the pediatric age group patients,
sir,
they will be
hemorrhages.
running and they will be, they will be falling on the ground. So the bleeding into the joint is very common, and that is where you have a suspicion that yes, he may have some factor deficiency, be it any, be it A, B, C, be it any other disease. Okay?
Okay, sir. Thank you, sir.
Now we move to the last participant of the final round of What's Your Double Delta. Shubham Tripathi was finally MBBS student, King George's Medical University, Lucknow.
Good afternoon everyone. Myself Shubham Tripathi from MBBS 2018 batch. I am here to present a case on abdominopelvic mass in a postmenopausal female. Abdominopelvic mass, when it presents in a postmenopausal woman, is more likely to be of malignant etiology as compared to other age groups. And ovarian cancer can be one of the differential diagnoses of the abdominopelvic mass in a postmenopausal woman. It presents with non-specific gastrointestinal symptoms, so its diagnosis is very difficult and it is made at the advanced stage. But it is one of the most important cancer among females, and it accounts for almost 6% of death due to all the cancers. This presentation will highlight the importance of varied presentation of ovarian cancer, its approach, and also highlight the importance of ruling out gastrointestinal cause before making a diagnosis of ovarian cancer. My case is of a 55-year-old postmenopausal housewife, resident of Lucknow, who presented with the chief complaints of pain in the lower abdomen for 2 months and mass in the lower abdomen for 2 months. Patient complains of a dull aching lower abdominal pain, which is insidious in onset, progressive in nature, pain is non-radiating in nature, and is not associated with any aggravating or relieving factor. No association with food intake, and pain is not relieved by taking over-the-counter medication. Patient also complains of a mass in the lower abdomen, which is insidious in onset and progressive in nature. It progressed from a size of 2 finger breadth to a current size of 5 finger breadth in a span of 2 months. Along with mass, patient also complains of the bloating and feeling of fullness even after a small quantity of food. Patient also gives history of weight loss and loss of appetite. So this is a very short history of 2 months, and there is rapid progression, and also patient complains of weight loss and loss of appetite. So this may point towards a malignant etiology. There is, to rule out the gastrointestinal cause, we ask certain histories. There is no history of variation of size of lump with cuff, straining or posture. To rule out the hernia by the age of the patient. Then no history of alteration of bowel habits or blood in the stools. To rule out any gastrointestinal causes. No history of fever, cough, evening rise of temperature, because encysted TB can also be present. And there is no, now according to the mass, no history of increased frequency of the urine, dysuria. There is no history of bleeding or leaking PV, as it can be seen in the granulosa cell tumor. Then there is no history of chronic leg pain or pedal edema, no history of acne, hirsutism or voice change, as it can be seen in the sex cord tumors of the ovary. And there is no history of lump in the breast, nipple discharge or axillary swelling, because breast can be the primary for an ovarian cancer. And there is no history of any GI surgery, because colorectal cancer can also be there previously. And there is no history suggestive of any metastasis. Menstrual history, the significance is a patient attained menarche at the age of 14 years, and since then her cycles were regular and there were no menstrual abnormalities, and she attained menopause 5 years back. Obstetric history, she is para 2 plus 0, living 2. Her obstetric history is uneventful and both the childs are living and healthy. Past history, there is no history of any surgical or medical treatment of any tumor in the body and no history of comorbidities. Personal history, patient is, there is no history of smoking, alcohol and addiction, non-vegetarian by diet, and then the only complaint is there is loss of appetite. Family history, that there is no history of death due to any cancer in family, because BRCA mutation can run in families, and patient belongs to lower socio-economic class, lower middle socio-economic class according to modified Kuppu-Swamy scale. Examination, patient was conscious and oriented, thin built, and BMI was 16.88 kg per meter square. Her vitals were normal, pallor was present, icterus, cyanosis, clubbing, lymphadenopathy, pedal edema are absent. Respiratory system, bilateral symmetrical chest wall, bilateral symmetrical chest expansion and vesicular sounds were heard. This will rule out the pleural effusion which may be present in ovarian cancer. CVS and CNS system were within the normal limits. Breast, bilateral, soft and symmetrical, no lump felt, no discharge. Axillary lymph nodes are not palpable. In abdominal examination, inspection, abdomen is flat, umbilicus is central and inverted, no scar mark, dilated veins, visible peristalsis or pigmentation seen. All quadrants move equally with respiration and all hernial sites appear free. On palpation, there was no rise of temperature and no tenderness. A lump is palpable in the hypogastric region of 10 into 8 centimeter. It becomes less prominent on making the abdominal muscles taut. It does not move with respiration. It has ill-defined margins, irregular shape, firm to hard consistency. Mobility is restricted. Tenderness absent and all hernial sites were intact. No fullness in left supraclavicular fossa. So the irregular shape, ill-defined margins, limited mobility and the size, they point towards a malignant etiology. On percussion, there was dull note over the lump and no shifting dullness or fluid chill was present. Auscultation, normal vowel sounds were heard. On pelvic examination, in PV, cervix was forward, uterus is retroverted, a nodular mass is felt through the posterior fornix. On bimanual, cervix was stationary on pushing the abdomen, on pushing the swelling up from the abdomen to differentiate it from uterine swelling. So from this our differentials, diagnosis were ovarian tumor or gastrointestinal malignancy, ancestor tuberculosis or a tubo-ovarian abscess. So for that we carried out certain investigation like ultrasound abdomen pelvis. On this uterine boundaries were poorly defined and both the ovaries were enlarged, hypoechoic and heterogeneous inico-texture and raised vascularity. Small amount of free fluid was present in pouch of Douglas and interbowel space and no para-aortic lymphadenopathy. We carried out CT scan for the operability and the resectability of the tumor. There was a large ill-defined heterogeneously enhancing soft tissue lesion in abdominopelvic region with moderate ascites. We carried out certain serum markers. Serum CA125 was highly raised. So the management was exploratory laparotomy plus total abdominal hysterectomy plus bilateral salpingo-operectomy plus omentectomy. Midline vertical incision was made and ascites was noted. So fluid was collected for the histopathology. Omental thickening were present. Liver and undersurface of diaphragm appears normal, and there was evidence of bilateral ovarian mass which were removed and sent for histopathology. And because there was omental thickening, so partial infracolic omentectomy was done. A 2 centimeter disseminated tumor mass was noted in the right inguinal region, which was removed and sent for histopath. Ascitic fluid cytology was positive and it showed anisocytosis, cellular aggregates and increased chromatin, And for both the tumors in the right inguinal region and the ovarian mass, the diagnosis was serous cystadenocarcinoma. FIGO staging is stage 3C ovarian carcinoma. Post-operative treatment, patient received 6 cycles of paclitaxel carboplatin and patient is advised follow-up for recurrence. Conclusions are, ovarian cancer can present with very vague symptoms, so its diagnosis is very difficult. Patient keeps on visiting general physician or the gastroenterologist. So always when a postmenopausal woman presents to the PHC or any center with non-specific symptoms, ovarian cancer should be kept in the mind, and we should rule out the gastrointestinal malignancy before making the diagnosis of ovarian cancer. These are my references. Thank you.
You have crossed time limit. What do you think? What is rare or interesting in this case?
Commonly when a female goes to gastroenterologist or physician with GI symptoms, they give medicines according to the GI pathology, but they miss out the ovarian cancer.
So what exactly take home message you want to say?
Whenever a postmenopausal lady will visit any center with non-specific symptoms, GI symptoms, then we should think of ovarian cancer and should palpate the abdomen.
Yeah, very definitely. So ovarian cancer usually presents with these type of non-specific symptoms. Good.
No question, just a comment that you understood your topic well, and you gave explanation about your negative history. Why did you take those negative histories? Only thing is that it was very elaborate. You should have been concise and to the point. Thank you.
Shubham, very nice presentation. I want to ask, like everybody, I'm asking two questions. Yours patient is a 50-year-old, 55-year-old postmenopausal lady. Is she a housewife?
What, sir?
क्या करती हैं? Housewife हैं?
Yes, sir, housewife.
कहाँ से belong करती हैं?
Lucknow.
Lucknow से. So any housewife belonging to Lucknow or any region, 55-year-old lady, do you expect them to notice a lump which is 2-finger bread in abdomen? You said it was initially 2-finger bread, then it enlarged to 4 or 5-finger bread, whatever.
Sir, she approximately told that.
Okay, so that is actually hard to discuss, that point. So you have to just retrospectively ask very politely and nicely, because these questions can, this spending can be questionable. Because even we as medical graduates, we are also, sometimes we don't notice such small lumps in ourselves only. Okay, so any housewife or any literate or even illiterate person, it's very difficult for them to notice such small lumps, that too in abdomen. If they are superficially located, easily even smaller lumps, smaller than 2-finger bread, can be noted on face or neck or in exposed area. But on abdomen, small lumps, very difficult to appreciate. Anyways, second point, you said in your presentation that supraclavicular fossa left side was normal. So is there any specificity about that?
Sir, GI malignancy or ovarian cancer that can metastasize to left supraclavicular lymph nodes.
How come they can metastasize to their area? Just tell me that.
Lymphatics.
Lymphatics, ovary are located in pelvis. How can they metastasize to left supraclavicular fossa?
So transilomic route or the.
Okay, yes. That is true. How transilomically? How? Good.
Okay, Shubham, wonderful presentation. You have mentioned one negative history, that there was no passage of blood in the stools. Why did you ask that?
Sir, to rule out any colonic malignancy, colon cancer, it could be there.
Tell me, which type of colonic malignancy were you suspecting in a patient who's coming to you with a history of 2 months? And as sir mentioned that, 2-finger bread and then 4-finger bread. So which kind of a GI malignancy are you suspecting, apart from, of course, the ovarian malignancy that you presented, that you wanted to ask this thing that, there is no passage of blood in stools?
Sir, adenocarcinoma of colon.
Okay, fine. One thing that you have mentioned is a very simple, basic question I'll ask. You mentioned about the Kuppuswamy scaling in socioeconomic status.
Yes.
But can you elaborate about this scaling system?
Sir, it uses 3 parameters, the education of the head of the family, occupation, and the family income, per capita income.
Okay.
Then we divide them into classes, lower class, upper middle, and upper class.
Are there any other parameters also to understand the socioeconomic status of a patient? Apart from this Kuppuswamy scaling, are there other parameters as well?
So in rural areas, BG Prasad scale is there.
Good. Right. Thank you.
Shubham, you have presented very nicely. I would like one comment. How will you differentiate your tubular mass with tuberculosis, or it is a malignancy? Which one test would you like to perform in this patient?
Ma'am, tuberculosis can, there would be a history first of all of fever, cough, or evening rise of temperature. On examination, there could be lymphadenopathy, matted lymph nodes would be present. In our case, there was no lymphadenopathy. And
any histopathological examination or any histopathological examination finding would you like to explain regarding this, or any other finding?
Granulomas we could see. KG.
Okay. In case of
TB.
Yeah, good. Thank you.
I request our judges to say a few words.
I think it was very well conducted. Congratulations to the organizers. I think this is the first time we are seeing such innovative, in the Rhapsody kind of thing. Because we always say, हम लोग entertainment के लिए करते हैं, Rhapsody enjoyment के लिए, but bringing such topics like case presentation and research under this umbrella of Rhapsody is very encouraging. We must congratulate the organizers. Very beautifully conducted. And obviously, जैसे last में बोला था कि when we have more attendees, जब लोग ज़्यादा रहेंगे, तो it is better to appreciate and better to learn also. Good learning platform. And all presenters very beautifully presented. मतलब presenting any case, even if you are on second year level or third year, even final year level, presenting on a such big platform, on a stage, you learn, because we learned on after in our post-graduation and after that. So learning at this level is very important. This is a very first big milestone that you are presenting beautifully on a stage. Very beautiful. Congratulations to all.
This was a wonderful presentation by all the participants, and undoubtedly it requires a lots of guts to stand here and give your presentation. And of course, as Sir mentioned, that there should be more attendees, I believe, right? It gives more confidence to the person who's actually presenting there. Okay, and thank you so much for inviting me as a judge. Thank you.
Congratulations to organizers. I really feel that amidst this ho-hulla, hurdang of real Rhapsody, you people are organizing such an academic event, and so maybe attendees are not in this much number, attendance is not good, but this is really a good effort. Missing those entertaining part and attending this academic event, attending this academic part, this is really difficult, but definitely congratulations to all of you. Thank you so much.
I would just like to congratulate the organizers and the participants. Everybody spoke very eloquently, and this is...
You all have presented very well, and I would like to congratulate all the participants. And without much delay, because we are running late 1 hour, so without wasting much time, I would like to congratulate all our winners in front of me, all of us. So thank you, organizers.
Meanwhile, we also like to welcome our sharks for the next event, that is the Georgian Shark Tank. Professor Rishi Sethi sir from the Department of Cardiology, Dr. Pooja Ramakant ma'am from the Department of Endocrine Surgery, Dr. D. Himanshu sir from the Department of Medicine. Our chief guest for today, Dr. Uma Singh ma'am, and Dr. Nishamani Pandey ma'am from the Department of Geriatric Mental Health, Dr. Vimala Venkatesh ma'am from the Department of Microbiology, and also Dr. Garima Saigal ma'am from the Department of Anatomy.
So third prize goes to Shubham Tripathi.
The second prize goes to Shreya Verma.
So this is our second prize also, है ना Shreya? In last session also you received the prize.
Congratulations, Shreya. Lucky day. Since morning you are getting the prizes.
Okay, so Abhishek Kumar for the first prize.
We'd like to felicitate judges for the event. So first of all, to Dr. Manjulata Verma ma'am from the Department of Obstetrics and Gynecology. Next, Dr. Arpita Briguvanshi ma'am from the Department of Pediatrics. Dr. Kushagra Gaurav Bhatnagar sir from the Department of General Surgery. Dr. Deepak Bakchandani sir from the Department of Medicine. Dr. Jyoti Vajpayee ma'am, our teacher in charge and also judge from the Department of Respiratory Medicine. Ma'am. Dr. Nishamani Pandey ma'am. Dr. Vimla Venkatesh ma'am. Our chief guest for today's event, Dr. Uma Singh ma'am. And also special guest for the event, Dr. D. Himanshu sir from the Department of Medicine. We'd also like to have Dr. D. Himanshu sir as one of our sharks. Before starting, I'd like to mark the presence of all of our teams. The another side, Soma. Yeah, please occupy the front benches. Soma, Health E. Ravi Vafire. Ravi Vifaya. Ishan Gaurav Kritya. Yeah. Medicoy Nova. Rising Phoenix. Tanao.
Good afternoon, everyone. I'm Aditi Shah, and
I'm Shubhajit Roy.
and today we will be your host, or better say it as Dolphins, in the year's Rhapsody's flagship event, the Georgian Shark Tank. Let us introduce you all what a Shark Tank is in detail. It is a culmination of two ideas, that is the concept of hackathon that has been originated in the engineering branches, which we have transformed into a med hackathon and blended with the concept of Shark Tank, which originated from Australia and all the way from America. It entered India this year.
So, this year, AIMS New Delhi started with the concept of Med Hackathon. And this is the fourth Med Hackathon happening in this year. So, we thought, why not mix it with business ideas and make it a full-fledged Shark Tank? So, this is the first Shark Tank, Med Shark Tank that I'll say, that is happening in the entirety of India. So, we had released two problem statements. That the first one was preventing the disease X, and the other was mental health analysis and suicide prevention. So all our teams had prepared some innovative and ideas and apps and gadgets, and are now going to pitch it in front of our esteemed panel of sharks. And they will be marked on the basis of their business ideas and also the innovation. So when I call the participants, all the members of the team are to come and pitch their ideas in front of the sharks, standing on the right side of the stage. You'll get 6 minutes for presentation. That should include both your innovative ideas and the app or gadget that you've prepared, plus your business ideas. And then there'll be a 2-minute session of question and answers by the panel of sharks. So let's call the first team for today's Georgian Shark Tank. The another side, members are Neha, Nitika, and Anjali from KGMU.
Good afternoon to all the esteemed faculty members, our respected seniors, juniors, and our beloved batchmates. So we, the team members of another side, me, Nitika Chaudhary, Neha Acharya, and Anjali Srivastav, will be going to present a business model that is an application on the topic mental health and license and suicide prevention. So we are going to propose a business model that is an application which deals with the analysis of the mental health status of an individual, which is based upon the grading system that we include an algorithm that rates the mental health of the individual on the basis of scoring, which is 1 to 10 based upon the comprehensive questionnaire. Based upon the score of the individual, the app will provide the information regarding the further course of action. So the name of our application is Another Side, which involves two different parts, so that is an analysis and the solution. So here's the logo of our application. So I'm handing over the mic to Neha Acharya, who will further enlighten about our application.
Very good afternoon, everyone. So I'll be basically elaborating upon the two components of the app, which is analysis and prevention of the mental health issues. So first, if we talk about analysis, basically the application will be grading the mental health of an individual on the basis of the score which is obtained after solving a comprehensive questionnaire, which is having a few of the set questions that will be dealing with the mental health of the individual, or they'll be basically analyzing what is the mental health status of the individual. The sample questions which are proposed to be included in the questionnaire are given in the next slide. So, like few examples are, first one, during the past 4 weeks, how often has your mental health affected your ability to get work done? So in this, there are basically 4 options: very often, for which the score will be 0, somewhat often, for which it will be 1, not so often, for which it will be 2, and not at all, will be 3. So basically, the person will have to answer all of these questions, and based upon the checkboxes which they're ticking, we'll be giving them a score by adding all of the scores individually. After that, we'll be basically using this grading system in which we are looking at the score, and we are basically categorizing the severity into moderate, mild, and severe. So if the score is 0 to 7, then it will be mild. If it is 8 to 14, it will be moderate. If it is 15 to 21, then that will be severe. Now we consider the solutions. So solutions have been basically divided into the 3 categories on the basis of the severity of the issue. The first one is mild cases. So there are basically 3 solutions that we have come up with. The first one is a gratitude window, in which the individual will be basically encouraged to write 3 things that they are grateful for at the end of each day. So an app alarm will also be set up for the same as a reminder at a fixed time, which will be decided by the user himself at the end of each day. They are supposed to do this. Second one is the app will be generating daily motivational quotes that will be popping up on the window of the person's device at regular intervals of time during the day. And lastly, the app will also be providing daily incentives for performing certain interesting tasks, like for example, walking 1,000 steps in a day, skipping rope 50 times, or helping at least one person in need, etc. So this will basically provide the user a sense of contentment, a sense of completion, so that will basically provide daily motivation to the user. Then we come to moderate cases. In moderate cases, the initial 3 solutions will be repeated. Apart from that, there is an additional solution that we've come up with, and that is basically chatting with an app assistant created using AI. This is very much similar to Google Assistant. So many of the times when we are looking for some entertainment, we start talking to the Google Assistant itself. So it's a similar kind of a thing. So this will be useful for those people who are hesitant about openly speaking regarding their problems, and there is nobody who's going to disclose this to others as well. Finally, in severe cases, again, the initial 3 things will be repeated, but lastly, we'll also be providing certain links to directly connect with the medical consultants for further course of treatment. This is because we know that when the severity of the mental health issue exceeds a certain level, AI cannot be completely relied upon. So we need to take medical help. So for that, we'll be providing, we'll be giving them chance to directly connect with the medical consultants. So now I'm going to hand over the mic to Anjali, who will be explaining why to opt for this app and what are the business strategies that we're using.
Good afternoon. So first of all, these are the things, the unique features of our app that would make the user easy for using the app. Our application will provide early identification and analysis of possible mental health patients. Secondly, it will provide easy access to healthcare support. It will provide self-assessment of the patients. It will monitor improvement in the mental health status of the person. There would be integrity of the information, and we will provide consultancy at individual level. Then, with a business frame of mind, we have thought of some strategies that would help in revenue generation as well as advertisement that would help in expansion of the application. So here are some earning strategies. The application will be available on basis of monthly subscription, which would be free for the initial 1 week, following which the user have to pay $199 monthly for subscription. The app will also generate revenue through in-app advertisement. And finally, with the help of search engine optimization, our application would be easily visible on different search engines. Here are business expansion strategies. Firstly, advertising the app on various platforms such as newspaper articles, medical magazines, which would familiarize the healthcare workers with the app, and in Google Ads. We will also promote the popularization of the app by the consultants recommended on the app, and this would increase the customer base as it would include all the other patients of the consultants as well. Thank you.
A regular basis. So we'll also be like revising the questions which are being asked. So we'll continuously see their grading. If we see that it is continuously decreasing or deteriorating, the score is deteriorating, then we will directly connect them to a medical consultant instead of completely relying on the assistant.
How do you attract them that they pay for it, because they may be not liking to pay?
Yes, ma'am. If the app is helpful, like that's why we've provided a free 1 week period. So if they find it helpful in the initial 1 week, like the incentives that we're providing, the motivational quotes, then they will themselves want to continue if they find it attractive. Also, we will also take help from the consultants that they recommend the same app to their patients so that we can increase the customer base.
Thank you. So, interesting idea. Just tell me, in your logo, you have put a girl there. Why?
Ma'am, this basically shows that the human mind may seem to be extremely simple, but there are a lot of things which are going on inside, which may not be visible from outside. So, the girl...
You used a girl to... Do you think it is more in girls, or do you think girls... Is that so? No, it's not that so. That is her interpretation. So, okay. I thought maybe you have done the research and found that this is more, the problem is bigger in girls. Have you actually done the research? Where is the problem bigger?
And this is mostly in youngsters, in adolescence groups, like 15 to 25 years of age, because of various stress, like studies, like due to many things, like they're involved in, because of career problems, etc.
Okay, thank you. A nice presentation. I was also having the same question as ma'am said, because and my question is, definitely the app will work if there will be awareness, but you have written that 0 to 7. If 0 will be there, how mental health issues will be there? Why it is my problem? If someone says 0, if there is no problem, how you say that it is psychological issue?
Ma'am, this app is not just for those who are mentally ill, but it could also be used as an app which is basically providing daily motivation. So if somebody's score is 0, then that is very good. That means they're not having much of an issue. But if those daily motivational quotes are there, like we have our ups and downs every day, we might not be feeling very good one day, but we are feeling very good the other. So that doesn't mean we are mentally ill or we are depressed, but that daily motivation always helps.
So there might be a normal range, no?
Ma'am, because of that, only in the mild cases, we have just kept gratitude window, the motivational quotes. That means like no one is particularly perfect. That would help in improving the mental status of any individual. Continuous upliftment and continuous mood monetization throughout the day.
I had one small question for you. Nice presentation. You put together a nice set. I really want to know is, you put some questions, right? So the app is meant essentially, I presume, for suicide prevention. Is that the aim of the app? Because your topic was mental health and suicide prevention, right?
Yes.
So was the app essentially a tool to help prevent
Ma'am,
suicide?
questionnaire was just for the analyst. Ma'am, basically suicide prevention can be achieved if we are uplifting the mental health of the individual. So the main aim of the app was upliftment of the mental health of the individual, so we can prevent suicide in future.
So how did you research these questions?
Ma'am, we basically researched. We took the help of the internet to see what are the different questions which are commonly included in these surveys which are being carried out throughout the world. So these were some of the questions which are most commonly used.
So I think it was a very good tool. It's a good tool for actually doing a mental analysis. Now the point of, let's look at it the other way around. What could be the places where, or what are the loopholes which have been left behind? As ma'am asked, are we really also going for suicide prevention? So you said that upliftment of the mood would be a way of actually decreasing the suicidal tendency, right? That's well and good. But when you have a business model, if you are claiming that, then there is always a tendency technically for also getting sued. When we do a research on what, so you're taking out an app and you say that this elevation can decrease a suicide. Suppose if it doesn't and it leads to a suicide, that leads to legal issues. So that is why you have to be very clear when you're creating an app, whether you are just going to do a analysis, and for suicidal prevention or further, you better go ahead, instead of saying that we are providing you links, this is not meant for prevention. You have to actually go to your own consulting. Why I'm saying this is, I mean, any model, when you create an app, this is, from there on, you have to look into the legal parameters. If you do, मतलब ये अगर बनाते हैं तो, that's point one. Point two is, whenever you have an app which is based or which relies on in-app advertisement system, then there is always this risk of also actually data corruption or data being hacked. Specifically, if we are going for an app technically, I mean on a practical component, specifically if it's an Android-based app, the tendency of it getting hacked would be much higher.
as compared to Linux-based app. So that's point two if you are trying to raise your finances through the advertisement, in-app advertisements as you suggested. Point three is if you have done the grouping, you have done the severity, so you have not given a point where does the treatment component start. आपने एनालिसिस माइल्ड मॉडरेट सिवियर तो कर दिया ना ऐप में द ट्रीटमेंट मैनेजमेंट कंपोनेंट को आप कहीं लेके नहीं आए. सपोज ही इज गोइंग टू सिवियर डिजीज, देयर विल बी सम फार्माकोलॉजिकल इंटरवेंशन विच विल बी रिक्वायर्ड. सो उसमें आपने बस लिंक्स दिए हैं, यू हैव नॉट गिवन दैट पॉसिबिलिटी और एट विच पार्ट ऑफ मॉडरेट वुड यू लाइक द पर्सन टू गो इनटू. यू गेट माय पॉइंट. माइल्ड तो ठीक है, आपने वो कर लिया लाइफस्टाइल इंटरवेंशन. मॉडरेट में तो सिर्फ आपका फार्माकोलॉजिकल पे जाएगा ना. So that component I thought was missed out, and in severe you just give links towards other possible places there, but you did not tell where the person has to move towards the pharmacological intervention. Those are the 3 points that come to my mind. Rest was very good.
Out of all this, we still have not figured out, are you asking us for money?
So that's what I wanted to ask. I mean, if it's really an idea that you want to present as a game show to us, or you really want some of our money, do you think it's really a feasible idea? Because then the level of discussion and questioning will change. If suppose we give 10,000 each to you and you have 1 lakh rupees in your pocket in university, do you think this idea is feasible? Do you think if we provide you with the infrastructure and the engineering background and everything, do you think this idea is feasible? Or you just want to present as a game show? Because then our comments would be different. Take your choice right now and be honest.
So it is feasible.
Game show?
No. Sir, it is feasible. We can bring this app into functioning if we, as sir pointed out, if we deal with the loopholes, then we can...
The name is brilliant, the logo is brilliant, the concept is brilliant, but I mean, what do you mean? Have you taken help of psychologists and psychiatrists in developing this questionnaire?
So we have used the previous surveys only.
What do you define as mental health? I mean, you can't take mental health as one gambit. I mean, how can you grade mental health? You have to have objective parameters. Which area is it going to? Depression, anxiety, ADHD. What is it remaining on to? What are your checklists that Dr. Himanshu was saying? What is your... So you can't classify as just... mental health is a very broad term that comes to mind.
Yes.
Think on those lines, but really speaking, the name is fantastic, the logo is fantastic, and keep on brewing on those ideas, and then we can go forward. Thank you.
Thank you, sir.
Soma on stage, and the participants are Manikya, Lakshmi, and Chelsea from KGMU.
Good afternoon, Sharks. We are the students of second year of King George's Medical University. My name is Madhukya Verma.
My name is Chelsea Yadav. And my name is Lakshmi Verma.
So today we pitch our idea of Soma, an online wellness firm which just requires 3 steps. As you can see from our tagline, happiness just 3 steps away. So Soma provides you something which regular health system forget. We all know the lacunae of our existing health system so as to provide overall wellness to a human being or an individual. And we all know that a healthy mind only resides in a healthy body. So let me ask some of the very basic questions that we want to ask. That is, are you happy? Are you satisfied with yourself? How is life going? Do you feel grateful for your life? So we don't mind just checking in. You can just look at these basic questions, but let's move on. So what is the idea? Soma is an online wellness app which has been designed by the psychiatrist, the dietitians, and the fitness trainers. We want to target the 3 main steps which are required for the wellness of an individual because we strongly believe that mental health isolatedly, it's something as a target that cannot be achieved. We can only achieve overall wellness and health as a singular target for an individual. So we are here to discuss. And to discuss with the psychotherapy that the Soma is going to provide, I welcome Chelsea.
Hello Sharks. First of all, I'll discuss about the challenges and what kind of solutions we have come across. In India, more than 85% of people actually doesn't aware about are they mentally sick. So first of all, we giving them education through our journals, through our content, what are the signs and symptoms by which they can detect themselves. Are they medically ill? Are they medically sick or mentally sick? Different kind of gradings we have, and then we'll provide them questionnaire by which they can understand their mental health, and on the basis of that questionnaire we will provide the medical therapy or we will provide the psychotherapy. We'll have different kind of psychotherapy like cognitive behavioral therapy and anxiety therapy. In these therapy we'll teach them how to proceed step by step and how to break the line of negative thoughts, and then we will provide them regular live chats, live sessions with their psychologist or psychiatrist, and then we will also provide them different kind of tasks so that they can evolve and they can break that negative things or negative line of thinking and rewire their brain, regenerate their brains. And then we'll provide them security. As we all know, a mental sickness is always a kind of stigma in our society. In India, it's like if any person is saying, if anyone is saying, I'm a mentally sick, it means he or she is a mental, he and she is a weak personality, but it's not so. That's why we'll provide the security, all the security level checks, and we'll collect their data, but do not reveal and try to save all the informations in our app, and we'll provide their forms in which they can analyze by themselves what are their mental progress, and these all things are available in the form of text, in the form of videos, and in the form of audios. Thank you.
Thank you so much, Chelsea. Well, we just discussed about the psychotherapy and the online consultants that we are going to direct our consumers and our community towards. Now let me tell you the next thing that we are going to discuss. That is the food. So we all know that food is something that is very important and it is totally tied to our emotions, and it is one of the best tools through which the mental health could be targeted, because numerous studies have shown that the health of our microbiome of our gut is directly linked with our psychological state. We have different types of food which can help us combat various types of depressive episodes, anxiety. Even some people use fooding as a coping mechanism to deal with the depression. So we want to provide healthy recipes, better ways through which food can be used as a medicine to treat the depression. But once we eat food, now exercise is necessary. And for that, I must welcome Lakshmi Verma to take this part.
तो मेरे पास आप सबके लिए एक एक्सरसाइज है. हम एक छोटी सी एक्टिविटी परफॉर्म करेंगे. तो फिर आप जैसे जैसे मैं करती हूँ आप भी वैसे ही मेरे साथ क्लैपिंग करेंगे. आप सब लोग भी करिए. तो कैसा लगा आप सबको? अच्छा लगा? थोड़ी सी एनर्जेटिक फील हुई? तो फिर यही हम आपको बताना चाह रहे हैं कि कैसे एक्सरसाइज हेल्प करती है हमारी मेंटल हेल्थ को. हम सब देखते हैं कि कोई भी पेशेंट हमारे पास आता है तो वो बोलते हैं कि हमें अच्छा नहीं लग रहा, हमें नींद नहीं आ रही. तो फिर यही हम आपको बताना चाह रहे हैं, जब हम एक्सरसाइज करते हैं हमें तो एक्सरसाइज सिर्फ हमारी हेल्थ के लिए तो अच्छी है ही, साथ में हमें खुश रखने के लिए भी बहुत ज़रूरी है. जैसे जैसे हम एक्सरसाइज करते हैं थक जाते हैं, फिर हमें नींद आती है. जब अच्छी नींद आएगी तो हमें अच्छा भी लगेगा. तो इसी तरीके से हम आपको ये अच्छा हम देश के सभी कोनों तक पहुंचाना चाह रहे हैं ताकि सभी लोग इसका बेनिफिट ले पाएँ. सभी हम आप सबको सिर्फ बोरिंग सी एक्सरसाइजेस के अलावा एरोबिक्स, जुम्बा डांस, योगा सारे सेशंस करवाएंगे. सबके शेड्यूल्स प्रोवाइड करेंगे. आसपास के जिम ट्रेनर से आपको कांटेक्ट करवाएंगे. पार्क्स और बहुत सारी कम्युनिटीज़ होती हैं जो एक्सरसाइज करते हैं पर उन्हें अपने मतलब एज का या फिर कोई नहीं मिलता है तो वो सोचते हैं यार थोड़ा सा अजीब लग रहा है, सब लोग बड़े हैं, सब छोटे हैं, उनके साथ करना. तो हम उनसे भी आपको कांटेक्ट करवाएंगे. तो आपको उनके साथ एक्सरसाइज करने आपके कनेक्शंस इंप्रूव होंगे, आप उनसे बातें करेंगे तो आपको अच्छा लगेगा. तो यही हम आपको प्रोवाइड कराना चाह रहे हैं. इसके आगे की बात आप हम करेंगे मानिकी के साथ.
So now all of you are clear with the basic idea of Soma. So now let me tell us
Time's up. Please wrap up.
So now let me tell us our business model. Through our extensive research, we have come across with specific groups of people that we know are adolescents from the age from 18 to 29, which we are going to target. With the help of basic form, the model that we're going to use is DAS 21. We're going to take the help of universities, specific corporation, as well as the coaching institutes. We are going to make it compulsory for them to use this form so as to create an online database so as to evaluate their mental status. Using this, a suitable treatment can also be provided. Coming to the economic basis or financial basis of this platform, we are going to provide a basal level of information to each and every of our consumer, because we all know that we all love what is free actually. But once the basal level of the material is done, we will also use subscription models and as well as ad verse so as to collect revenue. So this was our business model, and we would be very happy if any of the sharks, any of the judges would be really excited to pitch in with us to develop this idea into a successful model. Thank you very much.
So thank you very much. Good presentation. As a customer, I think I would like to join your, if whenever you are able to bring it in the actual field, I would like to join. Just tell me, why is Soma the name of the app?
Well, thank you so much, ma'am, for considering our firm. So let me tell you the story regarding Soma. So the Soma as a word has multiple meanings. Soma also means moon, the god of moon. So it also refers to healing. Soma is also the elixir of life, which indicates towards regeneration. Simultaneously, Soma also means body. It also means cell. Therefore, it means that we are targeting individuals and helping them achieve the best of health they can have.
Thank you.
And elixir is the sophisticated way of saying that. Soap and soma in actually in Sanskrit in the past was also used for, the word was used for alcohol.
Sir, I do understand, but I must say the first instant when Soma was mentioned, it was mentioned in Rig Veda, and it was referred as a drink that was used by the Devas as a means of entertaining and rejuvenating themselves. It was not said that it consisted alcohol, but in the later transcriptions and in the later text, it became one. So this
they actually also have in Rigveda shown how they used to make soma.
Yes, exactly.
And that actually is a fermentation of the plant juices. They have actually pointed that also in Rigveda.
Okay, sir, definitely.
You have made this app for exercise already. How do you ensure if like I want to exercise in the morning, somebody may like to do in the evening? So
Yes, ma'am,
how
that
do
we
you
had in our
ensure
business
that?
model. So what we are going to do, the app is going to target three main aspects. So first of all, as you know, we are going to be giving people, once we target specific groups of people, they could be given specific recommendations to join our app. The physicians can be asked to recommend our app. Secondly, as you asked for the question that how we are going to ask people for the exercise, same again, the consultations that we are going to provide, the motivation that the community, the online community that we are going to create, the community is a very powerful tool. An individual might get demotivated very easily, but once you're part of a community, once you have the right consultants, when you have the right motivation, it becomes very easy to exercise. And sometimes the problem comes to the point because the exercise that you're going after is quite difficult for your level. The exercise is not adequate for you. So our trainers will also make sure that the exercise that you're doing is adequate for you. Let it be yoga, let it be Zumba, let it be weight training. We will make sure that the workouts are curated specially for you. They are specially respected for your age and they will meet your requirements, and we will try our best in that.
And how do you check they are doing correctly?
Yes, ma'am.
How do you check they are doing correctly?
Ma'am, as we discussed that first of all, the exercise has different levels. The basal level of exercise is something very simple that everybody can achieve on a very simple level if they even do a basic form of exercise. But for advanced exercises, just like advanced therapies, we have doctors, we have psychiatrists. We are going to give them list of gyms, the workout spaces where they can go and directly interact with trainers and work out over there.
Thanks.
Thank you so much, team. It was a wonderful, it is a wonderful. Hello. I wanted to know that how you will initiate it and how you will get awareness among people.
We'll spread our information in the form of pamphlets at the primary, secondary, and tertiary healthcare institute, where normal people visit there, and they read our template and get the knowledge. That's why I'm saying a first form of our app is educate people about their mental health. We'll first educate them and try to enhance their knowledge, and then they'll seek for help.
Okay. The theme is about mental health and suicide prevention. So have you added that also?
Ma'am, as I said initially, I strongly believe that mental health as a single spectrum, as a single dimension cannot be targeted. I strongly believe in that. Because even if you go for the clinical treatment of depression, 50% of the depression do not respond to the treatment. This is something that is proven by most of the researchers and studies. It relapses after a period of time. So I believe that if we involve every aspect of health, an entire well-being is something that is required to put the person in a state of well-being, in a state of health, that will not only cure mental health issues but also cure the physical health dimension of that individual.
So what do you think, what will be needed for this? What resources you will need?
Yes, ma'am. So the basic step, though we had the idea in the pipeline, the basic idea would be, it would start by creating an online plethora of content, which would include online videos, it would include online vlogs on one of major social media sites. So this would disseminate information to the public, to the people, so that they know that we have an online platform that they can reach up to us, first of all. Secondly, comes to the consumer base or the people that we want to target. As I already said, we can attach a very simple DAS21 form or a DAS21 index. We can use it and ask the corporations, the major corporations, because I believe that the 9 to 5 workers in corporations, they have extreme stress of the work they have. This simple stress analysis, the DAS21 form, could be used as a database to collect information of their mental status, and hence they could be asked to be referred to our app, or we can directly consult them about it. This can also be used by major coaching institutes. Even this can be used by the universities, because in the entire medical professional, if you see the data, the nurses are the ones who are major affected by depression. After nurses, we have the junior residents. Then we have the professionals like doctors and the entire hierarchy of the system that we have. So I believe using this very simple form that is already existing, whose accuracy and preciseness is already tested, that is DAS21, we can use it to basically have a few idea that what is your status of mental health, and we can use it for our.
So I asked you that what resources you need to develop this SOMA.
Oh, we are going to require, first of all, we are entire group of psychiatrists. Then we would require dietitians and the workout trainers. Apart from this, to create the website, we would require graphic designers, the engineers, and software designers who would be working with all of us. As you see that this is a community, it is not just a single company, it is a community of a lot of people, and we would love to grow with all of them.
So what you need, actually?
So, come down to business. What is your costing model?
What, ma'am?
What is the costing model?
Ma'am, initially we don't want to initiate a costing model to it. We will create a basal plan that is free for everyone.
To create your free content, how are you going to there is a lot of free content on YouTube.
Yes, ma'am.
Right? So how are you going to you have to create better content than that?
Yes, ma'am, exactly.
So that will cost you money. So if you don't have a costing model, how will you succeed?
Yes, ma'am, definitely.
Two simple questions for you. Firstly, tell me, at second year of MBBS, how do you have so much clarity of thoughts and expressions? That's one thing, because you have actually nailed a lot of things correctly. So how do you have, you are being mentored by someone, or is it inherent in you?
Sir, I believe it is something that I've learned through practice. I have participated in multiple competitions. I tend to be natural, actually. I don't believe in I don't believe in having something that is written on paper. I tend to say what I think of, actually. So it comes very natural.
But in this app, someone is mentoring you, or this idea of SOMA, someone is mentoring you? Some psychologist or psychiatrist or a consultant?
No, sir. So we actually, so basically when we came to know about the Shark Tank, we were thinking of multiple things. So we were thinking of, we can just create a simple calorie app designer or anything, a workout.
Is someone mentoring you, yes or no? Now be clear. Okay, yeah.
No, sir.
Yeah. So
it is.
Now you were losing clarity of thought. This guy. And who has made these graphics? Have you picked up?
I have designed.
This painting, come to the brain painting. You have drawn these?
So you want to have a breakdown of all the graphics that are there?
This one.
Sir, the basic design of the cerebrum, this I took as a black and white image. Then the paint splashes, I have used Canva app to create them.
And the first one?
Sir, in this app, three basic softwares I have used. I have used the Samsung Notes app.
But it's your designing.
Yes,
it's not picked up from internet.
No, sir.
Absolutely fantastic. Thank you.
Thank you so much.
So our next team is Health E. Members Shivam, Parshav and Rohit from KGMU. Although I like to mention here that they had misinterpreted the topic preventing the disease X. They took X for anything, but actually we meant the disease X, the WHO definition. But still, upon lots of requests, we are allowing them to present.
Good evening, Sharks.
Myself Shivam Kumar Singh.
I am Rohit Bajaj.
And myself Parshav Goyal. And
We are the co-founders of Healthy.
First of all, we would like to apologize as we interpreted the disease X in a different way, and we presented it only on the permission of our coordinators.
As we all know that India is a country with vast population of around 1.5 billion people, and with huge numbers there come a huge load of patients suffering from cardiovascular disease and diabetes. And the very special fact about these diseases is that they can be easily prevented by minor lifestyle changes, which we are not implementing right now. So we are working upon these.
And also another important fact that according to recent studies, around 77 million people in India are currently suffering from diabetes, and the number is expected to rise up to 134 million by the end of year 2045. Also, the annual deaths occurring due to cardiovascular diseases in India has increased from 2.26 million in 1990 to 4.77 million in 2020.
And the very reason for such an increase in these numbers are sedentary lifestyle. People are lacking the necessary motivation to work upon their health.
These diseases are not detected early due to lack of proper health monitoring.
And the most important point, there is no such platform which quantifies the health of individual and provides a feedback mechanism of how much they have to improve and how much they have to work upon their health.
So Shivam, when are we coming into play?
And how are you going to motivate the people?
So we are healthy, and healthy we are, the basic idea is we are uniting health with e-commerce. So the e-commerce benefits which we are going to offer will act as a motivation to the customers to work upon their health and improve their overall health.
So how are we going to do this?
All right, let's come to the basic mode of operation which we are going to perform at Healthy. First of all, the customer will download our app or our website. It is basically the medium by which we are going to communicate with our customers. Then the customer will purchase our subscription, and then an appointment will be scheduled to the nearest diagnostic facility for a full body scan. And on the basis of this full body scan, we are going to form a health score.
Now, you all must be wondering, what is health score?
Actually, we have created a health score which is a personalized and a dynamic score. It will be based on the test reports of an individual. Tests like body mass index, blood pressure, blood glucose and lipid profile will make the major chunk of that health score.
So, Parsav, why are you emphasizing on these 4 criteria only?
Because these are the criteria which we can modify by a little change in our lifestyle.
So, these are our parameters for health score. The major ones are BMI, blood sugar, blood pressure and lipid profile, and the others are minor ones.
All right, Rohit. So, what is the significance of health score?
Health score is significant as on the basis of health score, we will provide our customers with certain deals and discounts on products such as health products and services, supplements, wearables, etc. and daily essentials. Now, let us understand this with an example. Now, we have our 2 customers, Shivam and Parsav. Let us assume that Shivam has a health score of 750 and Parsav has a health score of 600. Now both Shivam and Parsav will get deals and discounts on our products, but the amount of benefit that Shivam will avail on products will be much more than that what Parsav avails because of his higher health score. Now this will motivate Parsav to work hard on his health and improve his health score. In case you are wondering what happens if your health score is below the cutoff criteria, then then don't worry, we are still there with you. We will help you find the best of doctors to consult with.
We provide our customers with a convenience to choose a plan whatever they want. We have got an annual plan of 1200 rupees, a 6 months plan of 750 rupees and a 3 months plan of 400 rupees. Our annual plan of 1200 rupees is just equivalent to 3 or 4 Domino's pizza.
So Parshav, how are we going to make money in this model?
We have got a subscription model. We will have a tie-up with the diagnostic centers. We will have a tie-up with the e-commerce sectors as well.
All right, let's come to the aim of our company. The very first aim is early detection and prevention of certain diseases. Primarily, we are targeting the cardiovascular disease and the diabetes. The very significance of this is because most of the people are very reluctant in going for full body scans and the basic vital scans, which are more or less they guide us whether we are suffering from a disease or not. So early detection and prevention. Then, since we are offering incentives in the form of e-commerce benefits, these e-commerce benefits will provide the required drive to the users to achieve a better health score, and thereby they're increasing their overall health. Then the overall improvement of the health status of the society, and one of the most important aim is quantification of health. By quantifying health, we will provide room to the customers to compete even in their health scores. Like one can boast of a higher health score, and the other person will feel like, yeah, I have to work upon my health and improve it. And then final one is providing better deals and discounts. That's what e-commerce part comes into play. Thank you, Shaks.
And our future goal is to expand the concept of health score to various other sectors such as health risk analysis and health insurances. Thank you, sir.
Thank you, sir.
So which age group are you
Ma'am, we are including age group above 18 and below 60.
Why below 60? Any specific reason?
Ma'am, because people over 60 are not app friendly or are not tech savvy as such, and those people.
That's a bias. You're saying in front of a ma'am sitting here.
Sorry,
Ma'am.
ma'am, most of the population we are considering.
And actually, we will be forming different criteria for age-wise. Basically, we have not started working on the age-wise criteria because we have to collect so much of data on that. First of all, we will get the investment that we will hire and we'll work with other cardiovascular experts. We are currently in second year. We don't consider ourselves that much proficient to work upon that directly.
And are you excluding people who already are diabetic or have cardiovascular disease?
Yes.
Or are you including?
Ma'am, actually, we have specified in our model that if they are diabetic, their health score will be automatically less than our cutoff value. So they will be excluded from the system, but we will recommend them basic things like we will recommend doctors and medical facilities, but we don't want to make profit from them. We just want to make profit from almost healthy individuals. We are not suffering from some major disease conditions. It's just a motivation, informal motivation to the people to work upon their health.
And also, ma'am, if someone is suffering from diabetes, disease like diabetes, then treatment, the first requirement is treatment, not offers or deals that we offer.
And as we know that most of the cases of diabetes are still undiagnosed. And because of this motivation of this entire system, they can come and they can perform their tests and they can get an idea of whether they are suffering from diabetes or not. So it will generate some awareness among the people to get tested at least.
So just to have clarity on your model, the healthiest people will get the most discount.
Yes, ma'am.
But they would not need the supplement. So how will it benefit them?
Our e-commerce model is not only limited to supplements, it's also for daily essentials. It's just like Amazon and Flipkart, which is associated with health. And prime target is health equipment, but we will be localized to all the equipments.
Ma'am, and the healthiest of the individual has to maintain his health. Maintenance of the health is a very difficult task. He will maintain his health so as to continue the offers, so as to avail the offers.
And for example, we can get a six-pack ab in just 6 months working out every day. But to maintain it, we have to work. It's very difficult, ma'am. It just goes in 1 week or 2 weeks.
So technically, personally, if you ask me, I'm pretty happy with the model.
Thank you so much,
I think it's a very unique and business, though you did not actually target the actual question which was given to you. That's the only. Otherwise, I would be very happy. It's unique. It is something which would be commercially very viable, and the only thing is you need to also have some insurance policy because, I agree with you. Above 60, the chance of that. It's not about the thing. It's more about your costings will go up. That's something which you could have said. But do you have some insurance policies also inbuilt in that or not?
Sir, with time we will introduce that also.
The amount of subscriptions which you have mentioned there, do you think in that you would be able to give all the tests which are genuinely there? I mean, genuine because
testing prices are
separate.
Separate.
This is just a
we will provide,
price.
if anyone buys a subscription, we will
So
provide them
subscription
some
is this,
offers on the testing amount.
and the testing would be at
Different.
separate, those things. Okay,
we are
that's the
promoting-
hidden this thing in the...
Ma'am, actually, we are, yes, we are promoting regular testing. So we are promoting regular testing. In that, we are providing discounts on the testing if they buy the subscription model. Sir,
It is free. Yes, sir. First testing is free. Yes, sir.
So I take your 400 rupees subscription, get my test done for 1,000 rupees, and I don't do anything else. I just get a free 400 rupees whole body test. That's it. Thank you.
Sir, at the initial stage, most of the companies, most of the startups, they actually go in the they are in a very lost stage. They are more into acquisition of the customers rather than sticking. Thank you, sir.
Thank you, sir.
Now I would like to call Team Medico Nova on the stage, and the participants are Amrita and Priya from KGMU Nursing.
A very good afternoon, ma'am, respected judges and candidates. Today I am here to present my innovative idea, that is patients monitoring mobile devices. I am here going use both language because I am much comfortable in using the Hindi and English both.
Firstly, we will explain about what we explain in whole topic. First, introduction, then physiological functions needed to monitor, main objectives and existing devices which is available, and block diagram for proposed method, block diagram for app presentation, future.
Okay, sir. The main problem statement is preventing the disease. Sir and ma'am, एक ऐसे डिवाइस मैम हम लोग यहाँ पे इनोवेट करने के लिए बोल रहे हैं मैम. जनरली हम लोग जानते हैं कि KGMU एक बड़ा हॉस्पिटल है मैम, लेकिन मैम जब हम पेशेंट के पास जाएं तो पेशेंट पे ABG एनालिसिस करते हैं, EEG करते हैं, ECG करते हैं, डिफरेंट मल्टीपर्पज़ टेस्ट करते हैं, जिसके लिए हमको सफिशिएंट टाइम चाहिए और सफिशिएंट पेशेंस चाहिए, पेशेंट को भी और डॉक्टर्स को भी, ताकि वो इजीली ट्रीट कर सकें और पेशेंट भी इजीली कोप अप कर सके अपने सिचुएशन से. तो ये एक तरह का एक यूज़फुल सिस्टम है जिसमें हम लोग थ्रू फिजियोलॉजिकल सिग्नल्स ECG, ABG, PPG, EEG and many more multi-purpose parameters we are going to measure in this. Most of the जैसे सर्कुलेटरी सिस्टम की जो भी डिजीज़ेस होती हैं, पेशेंट डेथ कर जाते हैं बिना पता चले ही पेशेंट डेथ कर जाते हैं, जिसके लिए हम लोग को just hesitating ma'am, but generally ma'am it's a general condition because ma'am patient are suffering more and more, and we are going to do ABG again and again on patient. We are spreading infection to the patient. We are not going to prevent the disease if we are spreading the nosocomial infection. The main purpose of my device and my app system is ma'am. नहीं सर, जनरली एक ये डिवाइस है जो अटैच्ड है सिस्टम से, ऐप से, मोबाइल ऐप से भी, और एक खुद का सिस्टम भी है जिस पे डिस्प्ले होगी सारी वाइटल्स और सारी जितनी भी मल्टीपर्पज़ पैरामीटर वी आर गोइंग टू यूज़ हियर. सर ये फिजियोलॉजी सर ये सर एक्चुअली में हम अवेयर नहीं थे कि इसमें इमेज हम लोग को खुद से डिवाइस को ये इनोवेट करना है. Sir, the device is just an laptop size monitoring device, which was having an handle and a card. A card is used to for detecting the EEG, and the handle is going to use for assessing the vitals, EEG, ECG, and other parameter ABGs. The handle was just used by the patient. Just the patient was going to touch the handle, and through the handle there are many further. Next, this is used for the mobile. This is used for the mobile, but there are many micro monitoring controlling system on that handle, and different microcontroller processes were there. No, sir. That should be measured. That should be detected by that card. The card should be placed on the head of the patient. And the card was connected through a wire, which is connected to the monitoring device. Ma'am, through card. No, ma'am. Ma'am, the card was also having the monitoring microcontrolling processor, and the handle was also having microcontrolling processor. Ma'am, previous slide. Sir, for BP, sir, vitals are also going to be monitored through microcontrolling processor also. Sensors are there. Through finger touch. Yes, sir. Through finger touch. Sir, I saw on Google that there were many researches, that there were having many researches, but none of the researches, actually, sir, I am having an idea, but I am not able to explain it more clearly. Actually, when I am there, on my first day, मैम हिंदी में बोलना चाह रहे पर इंग्लिश आ जा रही उसका जो भी वर्क होता है वो लो वोल्टेज पे होती है, तो इसलिए उसके लिए जो सिस्टम में डिवाइस चाहिए होगी वो हाई कॉस्ट की चाहिए होगी, जिसके लिए मतलब अमाउंट भी उसके हिसाब से चाहिए होगा। बट अगर हम ह्यूज अमाउंट में अगर उस डिवाइस को बना रहे हैं तो उस डिवाइस के लिए मतलब अमाउंट हम कह सकते हैं कि अगर कोई चीज़ जैसे हम सामान लेने जाते तो होलसेल में लेते हैं तो वो सामान ज़्यादा सस्ते में पड़ जाती है अगर एक का मेजर किया जाए तो। इसी तरह अगर हम ह्यूज अमाउंट में बनाएंगे तो हमारे लिए एक डिवाइस की अगर अमाउंट कहें तो वो कम पड़ेगी। मैम मैम ICU के पेशेंट्स में मैम EEG भी होती है, मैम ABG भी होती है, मैम डिफरेंट मतलब मैम EEG ABG मैम मोस्टली फोकस ऑन ABG बिकॉज हम तो चाहेंगे कि EEG मतलब हो और बाकी रखो और डिवाइस को सस्ता कर दो। Yes, ma'am. The Actually, ma'am, I lost my father due to these all things. That's why I am here to.
We are just taking a technical break of 5 minutes. Network issues are there, so technical break of 5 minutes.
Now I would like to call Team Rising Phoenix on stage, and the participants are Shruti, Rashi, Sudhanshu from Motilal Nehru Medical College, Prayagraj.
Greetings, respected sharks. Today, I, Sudhanshu Singh,
I, Rashi Singh, and I, Shruti Katyar, members of Team Rising Phoenix. We are second year students from MLN Prayagraj, and we are here to pitch our idea on our app Momental, and my teammate Sudhanshu will continue with the same.
So, first of all, Momental, how this name came to our mind. So, basically, this is Intel is refers to technology. So, it is a technology that is meant for mothers. So, the problem statement that was given to us was mental health analysis and suicide prevention. So, here we will be targeting the mental health of the postpartum women. There is most common thing, that is postpartum depression, that is so common in women. So, before coming to our solution, I will be having a brief background of the postpartum. So, motherhood, it can be enjoying for some, but for some mothers, it is quite difficult and demanding. There are physical, emotional, hormonal changes, and it can lead them to sadness, anxiousness, and perplexed. So, often these are fleeting and referred to baby blues, which last for a week. But in some cases, it might prolong longer, maybe more than a month, and it can be converted into a serious mental disorder, postpartum depression. So, these are the signs and symptoms that happen in the postpartum depression: feeling of sadness, sleeping more than required or not sleeping at all. Even there is loss of interest in the activities, feeling failure as a mother. So few data are there which I would like to tell, that out of the 9 women who give birth, 1 woman suffers from postpartum depression. And out of 1 woman who have postpartum depression, they have the symptoms during the pregnancy. And it is one of the most common complications of the pregnancy. And 1 in 2 women who have postpartum depressions, they never had depression before. So it is a concerning thing. They earlier don't have depression, but they have now depression. So coming to our solution, what we are going to do, it is basically an AI, artificial based intelligence approach to monitor the health issues of mothers and detect for any baby blues and postpartum depression if there are any. So what will be our approach for this? what we'll be doing is the new mothers will be screened through apps inbuilt questionnaire that is based on Edinburgh postnatal depression scale. So it is basically a set of 10 questions, and it will do the routine, measure the 7-day routine activities of the mothers for past 7 days, and it will analyze various data. Also, apart from that, we are planning to have sensor data collection based on the physical activity and the mobility of the mothers on a regular basis. Apart from that, we will be also having online counseling and therapy sessions arranged if there is any trigger of baby blues evolving into postpartum depression. Apart from that, we will also be arranging for free or minimal cost postnatal services to take care of the me time of the mothers along with the help of NGO. Also, it will help to connect the mothers across the platform and will provide them a support group so that they can connect it better, because many women, they have some kind of taboo to come out of it. So how are we going to implement it? Basically, our idea is to introduce new mothers to this app during their visit to the vaccination centers of the neonates. So there, I have already talked about the NGOs. They will be going there, they will be telling them about this app, and apart from that, at the college level, we will also start with our doctors to encourage the women to take these apps. Apart from that, how are we going to manage our finances? So cost of online consultations and therapy sessions, that would be managed through the ad revenue system and also through the subscriptions that we'll be planning at a later stage. Apart from that, maternal and infant healthcare NGOs that I've already said, few examples are there.
Samta and HLF PPT are there some NGOs which
they would be arranging for the postnatal care services. And apart from that, we have also done our business model, strength, weakness, opportunities, and threat analysis. So what is the strength of this app? That it is not a diagnostic tool, it is a screening tool. It screens for the postpartum depression in the women. It will help in the data collection for the research purposes, which will help in further analyzing the problem. And it provides a solution-oriented approach. You just go on Android and search for a postpartum depression there. You will be getting there one app which is related to postpartum depression, but it will only give you a questionnaire and it will give you a score and it will tell you go there. But we are also providing them with the solutions that they would be approaching for their betterment. Apart from that, what are the opportunities? There is an emerging need for the app. I have already said it is least addressed issues, postpartum depression. I have already given the data. Apart from that, it is leveraging the capacity of the clinicians. Most people don't come to clinicians. So this app, if they would come more and more clinicians to their, through this app, clinicians will become more confident in approaching this postpartum depression, and also this problem will subside. Though there are some weaknesses, like we have resource limitations. First of all, managing of the capital and the workforce for the NGO is one thing where we are lacking. And we also have the missing expertise in some areas that would be requiring, that are coding and for the app development. What are threats to our app? There is risk of over-reliance on the technology that women can become. And through the ad revenue system, there can definitely be security breach, as I said. And still, there are taboo and stigma regarding mental health issues to come out and use that app. So these are some threats which can be there. At the end, I would like to conclude that it primarily focuses on mental health care, and it is going to fill in the shoes for the lack of the screening tool, and the routine data collection will be there to find out the proportion of women with postpartum depression in India. And it also aims to prevent the maternal morbidity that happens due to postpartum depression. These are the references that we have taken. Thank you so much, Shaks.
So, as an obstetrician, I definitely relate to this app, the concept-wise, definitely. But I couldn't understand, you said this app would be one AI-based. So you are going to use questionnaires and then the results later on to develop this AI. So to come to that stage where the AI can help you in screening, you would need to work on a lot of women. So have you included that cost? Because it won't be that just by screening 10 patients, you will be able to develop the AI. For that, you will have to work on lot of numbers. So have you included that? And secondly, would it be done in the antenatal period to assess postpartum depression or after delivery?
Ma'am, after delivery. And apart from that, first we are planning to have it development at the college level.
So if you are going to use it after delivery, then there is hardly any time left for doing any intervention or doing any prevention.
Ma'am, when they will be coming for the vaccination of their children, at that time.
That time already the phase has gone.
Ma'am, we have talked about two phases. The first phase which we are talking about is where they are facing just blues. In case of, if there are just blues, they will pass out in 2 weeks. The female will be normal and she'll be adjusted to the conditions. But if the female has already shifted to the condition of depression, then she'll be still feeling that anxiety and that overwhelming feeling, and that will still stay there.
So then it is not working for prediction and prevention. The disease diagnosis maybe then you are working for.
Ma'am, our main topic is postpartum depression. So we are working on that and not on the antenatal part.
Are you trying to prevent it or are you trying to diagnose it?
Ma'am, we are trying to prevent it in the sense that we don't want the
prevention
condition
should begin before the disease happens. Before she gets a blues, you should prevent it. She doesn't get a blues. That's what the concept is.
Ma'am, we are trying to prevent the condition from worsening at this stage, because we are at a stage where people are not talking. We do not have any research work regarding this. So this is just a beginning stage where we are, at least we want the condition not to worsen. So we are making it commercial in the way that it will generate income for the counselors and the psychologists that are...
And two things we have included, sir, that one thing was the app revenue and the subscription thing. By these two things we are planning for it to have it on a global level.
I would just like to ask something. Again, it's your own idea or you are being mentored by someone?
Sir,
it's our own idea.
This was Rashi's idea.
Great. And the animations, these animations you have drawn yourself or you have picked it from internet? You have drawn yourself. So firstly, it does appear to me a very, very commercially viable and a very, very interesting idea, provided a lot of hard work is put into it, and we are at some other platform in the process of developing something like that, but not in relation to the postpartum depression. So I think you failed to pick up the leads which very, very senior and sensible people were telling you to, that if your catchment area would increase a lot if you start targeting, let's say, even from the first or the second trimester of pregnancy. You can bring in other parameters which are very simple to measure in terms of your BP, your weight, your pulse rate, your ECGs, you're trying to build a community of pregnant ladies in between themselves, giving resources, giving information, trying to develop that community, because then your catchment area becomes huge and automatically you are able to even prevent early diagnosis and, if possible, treatment of this. So that is your market.
So for the same, we have kept the idea of the support groups as well. As we can see in our previous slide, that we have kept that this app also arranges for the support groups of the mothers.
Nita, what I'm trying to tell you is that you and we are not on opposite sides. We are not criticizing you, and you need not defend yourself. You need to pick up from the ideas and try to think on a different tangent. We all got it, but it is much, much bigger. When you say support group and arranging for nannies, it means you're going to have local physical point of contacts to arrange that service in at least 100 cities of the country. So we all understand that, but try to pick up. I think it's a great idea.
Thank you, sir. We'll try to inculcate all the
Thank you,
ideas
sir.
as well.
Now I would like to call Team Tanav on the stage, and the participants are Devansh, Aman and Ahmed from KGMU.
This team is not there.
बैच।
नमस्कार शाख्स, मैं अहमद रुशान 2021 बैच।
और हम हैं टीम तनाव।
हम हैं टीम तनाव। तो शार्क्स, इंडिया में 1.64 लाख डेथ एक्चुअली सुसाइड से होती है और 16 लाख सुसाइडल अटेम्प्ट्स इंडिया में होते हैं। और अकॉर्डिंग टू द डाटा, इंडिया में मलेरिया से ज़्यादा लोग सुसाइड से मरते हैं। मलेरिया से ज़्यादा लोग सुसाइड।
सो शार्क्स, हम आपके सामने पेश करते हैं तनाव को। तनाव एक प्लेटफॉर्म है जो हमारी स्मार्ट वॉच, फिटनेस बैंड और मोबाइल के डाटा को क्लिनिकली एनालाइज करेगा और उससे इंटरप्रेट करेगा और उसे बताएगा हमारे क्लाइंट को। जैसे जो ब्रीथिंग रेट, पल्स रेट और स्लीप वेक साइकिल आवर्स जो अब महज अभी तक नंबर थे, वो अब क्लिनिकली रेलेवेंट इंफॉर्मेशन उसमें से निकाल के हम लोग क्लाइंट को दे सकेंगे। हमने सुसाइड का रीज़न ढूंढने की कोशिश करी तो हमें पता चला सुसाइड्स के रीजंस काफ़ी डाइवर्सिफाइड हैं। ये टीनेजर्स में भी हो सकता है जहाँ पे वो फेल हो सकते हैं अपने कॉम्पिटिटिव एग्जाम्स में, एक एडल्ट में भी हो सकता है जहाँ पे उनकी लव लाइफ प्रॉब्लम्स हो, और एक एडल्ट फीमेल में भी हो सकता है जहाँ वो डोमेस्टिक वायलेंस फेस कर रही हो दाऊदी या दहेज की प्रॉब्लम से। इन सब का सॉल्यूशन हमने ढूंढने की कोशिश करी तो हमारा एक जगह ध्यान गया, वो थी हमारी स्लीप। हमने रिलायबल सोर्सेज से पढ़ा कि डिप्रेशन और मेंटल इश्यूज़ में जो हमें पहला सिम्टम्स या जो हमें पहली चीज़ हमें देखने को मिलती है वो हमारी होती है डिसरप्टेड स्लीप वेक साइकिल, जो डिस्टर्ब हमें दिखती है। इस चीज़ को एनालाइज करने के लिए हमने एक अपना एप्लीकेशन बनाया, तनाव ऐप। जैसे कि हमारे यहाँ कई सारे स्टूडेंट्स हैं जो कोटा प्रिपरेशन करने जाते हैं और हम देख सकते हैं कि स्मार्ट वॉचेस का ट्रेंड काफ़ी ज़्यादा बढ़ रहा है हमारी सोसाइटी में। हम देख सकते हैं कि 14 ईयर्स से लेके 60-65 तक की सब स्मार्ट वॉच पहनते हैं और अपनी स्टेप्स को मॉनिटर करते हैं, लेकिन हम नहीं एनालाइज करते कि वहाँ पे एक पल्स भी वो मेजर कर रहा है, वो हमारा फ़ोन हमारी स्लीप आवर्स को भी मेजर कर रहा है। हम उस इंफॉर्मेशन को यूज़ करेंगे। हम देखेंगे कि अगर 4 से 5 दिन तक की लगातार हमारे क्लाइंट की स्लीप साइकिल डिस्टर्ब रहती है और उसकी पल्स रेट फ्लक्चुएटिंग रहती है, जब जो हमने देखा रैपिड आई मूवमेंट स्लीप के भी 2 हिस्से होते हैं, रैपिड आई मूवमेंट स्लीप एंड नॉन रैपिड आई मूवमेंट स्लीप। हम लोग इस चीज़ को एनालाइज करेंगे। अभी हमारे पास इतना डाटा नहीं है, मतलब अभी इस चीज़ को एनालाइज करने के बाद हम 3-4 दिन तक की देखेंगे जब डिस्टर्बेंस है हमारे क्लाइंट जो घड़ी पहना उसके, तो हम उसके वेल विशर्स या उसके पेरेंट्स के मोबाइल पे एक नोटिफिकेशन सेंड करेंगे कि हाँ आपका जो वार्ड है या जो आपका क्लाइंट है वो मेंटली फिट नहीं है। उसका कुछ भी रीज़न हो सकता है। हम देख सकते हैं कि क्या पता वो लेट नाइट स्टडी कर रहा हो, क्या पता कुछ और इशू हो, लेकिन हम इसे बेसिक लेवल पे एनालाइज कर सकते हैं ताकि पेरेंट्स अपने बच्चों से बात करें, या कि जब डोमेस्टिक वायलेंस में डिप्रेशन फेस कर रही हुई फीमेल अपने पेरेंट्स से बात करे, वहाँ पे पेरेंट्स से बात करके वो सॉल्व कर सके और पेरेंट्स ध्यान दे सके कि कब उसको एक प्रोफेशनल की ज़रूरत होगी और उसे वहाँ पे जाने के लिए मोटिवेट कर सकें। हमारा बिजनेस, हम चाहते हैं कि एक कंप्लीट स्वस्थ भारत की तरफ जाएं, इस वजह से हम चाहते हैं कि ये एब्सोल्युटली फ्री हो हमारे कस्टमर्स के लिए, हमारे, और इसमें कोई भी ऐड ना हो, कोई भी ऐड ना हो, ना कि पेरेंट्स के मोबाइल पे और ना कि हमारे जो वॉच पहनेगा उस पर। तो फिर एक आता है कि हम लोग बिजनेस मॉडल सिखाएगा, ये तो समाज सेवा हो गई। इसका एक आंसर है, हम चाहते हैं कि हम डायरेक्ट टू बिजनेस मॉडल पे काम करें। डायरेक्ट टू बिजनेस मॉडल वो होता है जब हम किसी बिजनेस को अपनी सर्विस देते हैं कुछ अमाउंट के बदले। हम चाहते हैं कि रेडमी की चाहे 1900 की घड़ी हो या एप्पल की 50,000 की, वो सब हमारी डाटा को एनालाइज करें, है ना, और वो अपने आप को बेटर करें ताकि वो अपने जो भी उनका बायर है उनको एक कंप्लीट इन्फॉर्मेशन दे सके। और शार्क्स, हम यहाँ पे हैं आपकी एक्सपर्टीज़ के लिए, आपकी गाइडेंस के लिए, ताकि हम एक सर्काडियन रिदम साइकिल में ही सीमित ना रह जाएं और बाकी चीज़ों को भी हम अच्छे से एनालाइज करके और सारी क्लिनिकल इंटरप्रिटेशन उनकी निकाल सकें। थैंक यू। नहीं, हाँ, एग्जिस्टिंग एप्पल वॉच में एप्पल वॉच का एक एप्लीकेशन होता है, हम चाहते हैं वो एप्लीकेशन का डाटा हमारा एप्लीकेशन यूज़ करे।
क्यों देगा वो एप्पल तुम्हें?
नहीं, क्योंकि नहीं, जैसे हमारे यहाँ कई सारे एप्लीकेशन होते हैं जो हमारे मोबाइल के कॉन्टैक्ट्स यूज़ करते हैं। अगर आप उन्हें नहीं दोगे, ऐप वर्क करेगा। आप चाहते हो अगर ऐप को वर्क करना तो वो आपकी कॉन्टैक्ट की इन्फॉर्मेशन मांगते हैं। जैसे हमारी गैलरी है वो हमारी फोटोज़ की इन्फॉर्मेशन मांगता है मोबाइल में।
But you cannot ask, your app cannot ask Apple to give them their app.
नहीं, हमारा एप्लीकेशन मोबाइल फ़ोन में यूज़र से आस्क करेगा कि क्या वो आपकी इन्फॉर्मेशन यूज़ कर सकता है। अगर हाँ, अगर उसको अलाउ किया तो हमारा वो एप्लीकेशन यूज़ करेगा और जो हमारे पेरेंट्स में मोबाइल में जो एप्लीकेशन है कनेक्टेड है वो उनके में जाएगा।
आपके ऐप का नाम नींद क्यों नहीं है, तनाव क्यों है? बिकॉज आपने स्टार्ट किया कि हम सारी बॉडी की फिजियोलॉजी, पल्स, बीपी, मॉडर्न सबसे देखेंगे और बाद में आप केवल स्लीप वेक साइकिल पे आ गए। और स्लीप वेक साइकिल में भी आपका घड़ी पहना हुआ डिवाइस आरईएम कैसे डिटेक्ट करेगा? और चलिए पल्स रेट से आप उसका एक निकाल सकते हैं, बट इट्स नॉट एन ईजी थिंग टू डू।
पहली चीज़, हमारा हिंदी में नाम इसलिए है क्योंकि हम चाहते हैं कि
नींद हिंदी है
वो, और तनाव इसलिए क्योंकि हम ये चाहते हैं कि जो हमारा आज का टॉपिक है ये हमें आगे भी हमेशा याद रहे। आज का जो दिन है वो हमारी एक इनिशिएशन की तरह हो आगे के लिए, तो इसीलिए हमने एक तनाव चूज़ किया है। और जो हमारा वो होता है, और जो हमारी स्लीप साइकिल है वो हम लोग घड़ी से नहीं एनालाइज करते हैं, वो मोस्टली मोबाइल फ़ोन से एनालाइज करते हैं।
तो जब हम सो रहे हैं तो फिर हाँ मोबाइल कैसे? हाँ
नहीं, हाँ, ये एक चीज़ ज़रूरी है, जो हमारी फिटनेस बैंड है वो हमारे क्लाइंट को सोते हुए भी पहननी पड़ेगी। ये एक फिटनेस बैंड पहननी पड़ेगी।
बट देखो, फिटनेस बैंड मुझे भी अपना आरईएम देखना था तो मैं एक रात पहन के सोई, बट आई फेल्ट वेरी अनकंफर्टेबल वियरिंग दिस वॉच।
यस मैम, ये तो इस वजह से क्योंकि
मुझे तो पहनने से तनाव हो गया मेरा, मतलब स्लीप साइकिल डिस्टर्ब हो गया होगा बिकॉज आई वोट दिस टू एनालाइज कि नेक्स्ट डे अपना डेटा देखने के लिए।
यस मैम, ये चीज़ इस वजह से क्योंकि अभी जो हमारी वॉचेस आ रही हैं वो उस स्पेसिफाइड नहीं है। अभी हम लोग कॉस्मेटिक चेंजेस की वजह से बड़े डायल वगैरह पे जा रहे हैं। जो रेडमी वगैरह की स्मार्ट बैंड्स होती हैं वो काफ़ी हल्की और काफ़ी ये होती है, काफ़ी हल्की होती हैं। और उसके लिए क्या,
अगर मैं तुम्हारा और पिछले वाले जो टीम ने किया था उसमें एक्चुअली इट नीड्स डेटा फर्स्ट, द डेटा विच नीड्स वैलिडेशन, वेदर जो आप डेटा कलेक्ट कर रहे हो उससे आप एक्चुअली प्रेडिक्ट कर सकते हो कि नहीं कर सकते हो। सो मतलब on a very practical point of view, your idea and the previous team's idea is a very good research module idea which has to first collect data। जैसे तुम कह रहे हो तुम एप्पल से कलेक्ट करोगे, एआई में डालोगे, फिर उसके बाद करोगे। इट्स नॉट अ कमर्शियल आइडिया एक्चुअली, इट्स अ ग्रेट आइडिया, आई हैव नो डाउट अबाउट दैट। इट्स अ वेरी नाइस थिंग दैट यू आर टेकन रिसर्च एंड एवरीथिंग, बट स्टिल द डेटा फॉर टेकिंग दैट, उस स्लीप को लेके मैं उसको प्रेडिक्ट करूँ कि उसको तनाव होगा एंड ही विल गो, उसके लिए फर्स्ट ऑफ ऑल आई हैव टू हैव दैट मच ऑफ डेटा फॉर कलेक्शन।
सर,
हैव यू सीन दैट, हैव यू रेड अबाउट इट कि क्या स्लीप साइकिल से एडिक्वेट प्रिडिक्शन अगर किया जा सकता है? अगर आपने ढूंढ लिया है, सो अगर है तो बस ठीक है, फिर तो फिर तो कॉन्सेप्ट बहुत अच्छा भाई, हमारे बच्चों के बैंड हाथ में वो बैंड पहना दो, वो कितना सो रहे हैं या नहीं सो रहे हैं, उससे अगर पेरेंट्स को ये पता चल जाए, आई गो फॉर इट।
सर मैंने शुरुआत में बोला था कि हम लोग डायरेक्ट टू बिजनेस जा रहे हैं, हम डायरेक्ट टू कंज्यूमर नहीं जा रहे हैं। वो जो आपने बोला कि हम अपना एप्लीकेशन करेंगे उसके लिए हमें एप्पल से डाटा चाहिए, नहीं, हम एप्पल को अपना सर्विस यूज करने के लिए दे रहे हैं।
जब उसकी वैलिडेशन कंप्लीट 100% हो, अब जैसे बैंड पहना दिया, मैं यहाँ पे 50 में बैंड बना तो एग्जाम के टाइम में बैठे सबका तनाव निकल के आएगा, ठीक है, और सब जो है we will classify them, it's not. So what I'm trying to say, it's a great idea, and before going for an Apple को बेचने से you want to sell it to Apple or Redmi, उसके बाद तुम्हारे पास डेटा वैलिडेशन।
सर पहली चीज़ यही मैंने शुरुआत में बोला कि हम लोग आपकी मेंटरशिप चाहते हैं, आप लोगों के पास 40-50 साल का एक्सपीरियंस है, और एक ये भी है कि एक 40 सॉरी अपॉलॉजी सर, और सर
एक्सक्यूज मी मैम एक स्मॉल प्लेटफॉर्म बनाया है हमने कोडिंग के थ्रू, मैम दिखाना चाहते हैं आपको।
I'll invest. There I am. How much do you want? All mothers will do that. I'll invest for it. How much do you want? I don't have money, but I'll invest for it.
और नाम ऑफ ऑल मदर्स बिकॉज वो इन्वेस्ट करेंगे हमारे बच्चे सो रहे कि नहीं सो रहे।
And I like that point, that if person is sleeping well, that reflects directly. Who of us cannot support this? The day I have some stress, I wake up at 2 o'clock. I absolutely agree. I go for it. Go. Bye.
Now I would like to call Team Revivifier from KGMU on the stage, and the participants are Ishan, Gaurav and Kritya.
Good morning, respected judges, teachers, seniors, and my dear batchmates. Today, I'm Kritya Agarwala.
I Gaurav Yadav.
And we are students of MBBS batch 2021. Today, we are going to present our solution on the problem statement, mental health analysis and suicide prevention. So, let us first understand the aspects of the problem. What do you understand by mental health? It has three determinants: social, biological, and physiological. It can be determined by the school, peers, relationship, your physical health, your self-esteem, etc. What do you understand by suicide? As we all know, suicide is basically the process of taking one's own life, and the common causes are stressful life issues, maybe schizophrenia, bipolar disorders, emotional trauma, loneliness, depression, etc. In the next slide, we're going to tell you about what our main idea or what our app design is about, but before that, we would like to show you who our main targeted customers would be. First of all, it would be mentally disordered patients, drug-consuming patients, generally divorce cases, depressed students, or aged persons. Our app name is Revivify, and this is the logo which we've designed. It is basically a website and an app and is intended as a self-help and educational tool. It helps the patient to find better counselors and doctors, which helps to improve their mental health. These are the aspects of our app. First of all, it will help provide counseling, online courses, meditation and yoga, sound therapy or music basically, and it may also include shopping and other gaming features.
As you will open our interface, there are the following options. Which of the following best describes you? I am using Vify for myself, someone else, or learning. So we have included if the patient is the sufferer or the, यहाँ पे हमने ऐसे इंक्लूड किया कि मतलब अगर पेशेंट खुद यूज कर रहा है ऐप को या कोई उसका रिलेटिव उस ऐप को यूज करने वाला है, तो अगर पेशेंट खुद यूज कर रहा है तो यहाँ पे हम लोग के पास फॉलोइंग ऑप्शंस आएंगे कि वो अपने मेंटल हेल्थ को इवैल्यूएट करे, इम्प्रूव करे अपने मेंटल हेल्थ को, या वहाँ पे थेरेपिस्ट को कंसल्ट करे, इमरजेंसी सर्विसेज हमारे पास हैं और शॉपिंग ऑप्शंस हैं। जब आप इम्प्रूव मेंटल हेल्थ पे जाते हो तो वहाँ पे कोर्सेज अवेलेबल रहते हैं कि कैसे आप मेंटल हेल्थ को इम्प्रूव कर सकते हो, एंड साउंड थेरेपीज हैं हमारे पास, गेमिंग ऑप्शंस हैं हमारे पास। कुछ ऐसे मतलब हम एक मीडिएटर की तरह काम कर रहे हैं। यहाँ पे गेमिंग में हम लोग ने ऐसे कुछ गेम्स दिए हुए हैं जिस सॉरी सर इट इज ING सर, यहाँ पे हमने कुछ ऐसे गेम्स दिए हुए हैं जो कि मेंटल हेल्थ को इम्प्रूव करते हैं। वो पहले से हैं, हम एक मीडिएटर की तरह काम कर रहे हैं उन्हें कनेक्ट करने के लिए। एंड emergency services include there is a helpline number which patient can call, and there is a location if the condition worsen, then the app gives the location of several clinics of a doctor and trauma like KGMC trauma, and
सर जैसे सर ये इंटरफेस है, तो सर इसमें कंसल्ट थेरेपिस्ट अगर कर रहे हैं तो इस टाइप से इंटरफेस हम लोग का एडवर्टाइजमेंट है, मतलब कि डॉक्टर की प्रॉपर प्रोफाइल होगी। मतलब डॉक्टर जो है फिल्टर, मतलब हर केसेस के लिए अलग डॉक्टर हैं। भी डिवोर्स केसेस, रेप केसेस जो जिसमें पेशेंट डिप्रेस हो जाता है, हर सिचुएशन को हैंडल करने के लिए हमने अलग टाइप के थेरेपिस्ट लिए हैं। इसमें भी हम उसकी तरह काम कर रहे हैं, मीडिएटर की तरह। और सर इसमें हम चार्ज ले रहे हैं डॉक्टर से, मतलब कमीशन टाइप का ले रहे हैं। नेक्स्ट
सर, यहाँ पे जो हमने इंक्लूड किया हुआ है कि जैसे कि हम अगर डॉक्टर की प्रोफाइल दिखा रहे हैं तो यहाँ पे हम डॉक्टर से भी चार्ज ले रहे हैं, एंड ये जो हमारा ये जो फिल्टर अवेलेबल होगा वो सिर्फ सब्सक्रिप्शन पेशेंट के लिए अवेलेबल होगा, ना कि फ्री पेशेंट के लिए।
For example, if someone is mentally ill, that person wouldn't really want to go to a therapist or a doctor. So before that, we have certain courses or workshops that the person can attend and try to improve their own mental health.
Sir, this is basically about solving features. From here you can buy various medicines, various health products, and it's a delivery service also available. Sir, we know that a person can be myself or someone else. So if the person is any family member of that mentally ill patient, so we will provide an interface like a consult therapist, emergency services, guidance, e-learning, and buy health products.
Here by someone else, we actually mean it could be a concerned guardian or a friend maybe, if the person who is mentally ill isn't really ready to approach for help.
These are basically our emergency services. The call, we have not decided yet a number, so it calls call XYZ, call Samaritans. These are basically the NGOs, find urgent services and find emergency department, like the trauma centers. These are basically our effectiveness. That we act as a mediator to connect doctors and patient, different courses for different age group of people, exciting prizes for evaluating mental health, personalized counseling, and create our own safety plan and shopping features. Earning. We are earning charge per patient by doctors, earning through subscription, earning through local counselors, earning through shopping, earning through advertisement. And our investment are basically about the investment in advertisement of Fire. And this advertisement is basically targeted customers and the product cost and employee cost.
What is different about our app? What makes it special? Generally, we see that there are a lot of similar apps on Play Store, but what is special about our app is it tries to understand the whole of the patient. If it is music that helps them improve their mental health, we already have a wide variety. If it is shopping that they need, we can deliver the medicines readily. If they think that there are certain kinds of workshops or courses that might help them improve their mental health, we all have it ready. Thank you.
Our app has a safety box or life box. Basically, सभी को मतलब लगातार ऐसे सुसाइडल थॉट्स नहीं आते, कभी कभी आ रहे फिर अगर नहीं आ रहे तो यहाँ पे एक सेफ्टी लाइफ बॉक्स या एक सेफ्टी बॉक्स है जिसमें वो अपनी मेमोरीज को स्टोर कर रखा है या जिसे बात करना उसे अच्छा लगता है, तो अगर वो इस ऐप को यूज़ करता है उस वहाँ पे जाता है तो उसके देखेगा एंड हो सकता है उसका मूड वापस स्विंग कर जाए नॉर्मल, तो उन केसेस में वो हेल्पफुल है.
This is a good idea, मतलब to do that thing, but मुझे लगा थोड़ा सा biases हैं. Like you said, divorce cases, maybe somebody is married, somebody is single, may have depression. So how can you classify that this group of people have depression?
मैम हमने ऐसा नहीं कहा है कि मतलब हम इन्हीं पे मतलब जो बेसिकली जो केसेस हम इंडिया में होते हैं अबाउट 27% जो सुसाइड्स हो रहे हैं वो डाइवोर्स के बाद हो जा रहे हैं, तो बस हमने उसे हाईलाइट करने की कोशिश की है.
मतलब आपको मतलब अनबायस्ड सारा कैटेगरीज में इंक्लूड करना चाहिए. कैटेगराइजिंग देम एल्डरलीज और उस तरह से तो कुछ बायसेस इन्वॉल्व हो जाते हैं.
Ma'am, we're actually unbiased, but we just try to highlight who our main users could be. Like they're more prone to it. Just that.
एक प्रश्न मेरे पास है कि आप मीडिएटर का आपने बार बार कहा कि आप एज अ मीडिएटर काम करेंगे ना, तो मुझे ये पूछना है कि जब ऐप है और इंटरनेट की दुनिया है जो ऑलरेडी इस तरीके की चीज़ों में इन्वॉल्व होते हैं, उनके कोई जानने वाले कोई इस तरीके के वो बताएंगे और वो अपनी पसंद का कंसल्टेंट ढूंढेंगे या जो भी सहायता लेनी होगी लेंगे, वो आपके पास कैसे आए और क्या फ़ायदा होगा?
बेसिकली अगर देखा जाए तो पर्सन में सोशल स्टिग्मा होता है कि हम किसी से नहीं डिस्कस करें हमारी मेंटल हेल्थ के बारे में, तो हमारा जो ऐप है मतलब एक टाइप से कॉन्फिडेंशियलिटी रखता है पेशेंट की, और हमारे जो डॉक्टर्स हैं वो मतलब स्पेसिफिकली हर केस के लिए स्पेसिफिक थेरेपिस्ट हैं.
Able to guide them better as to where to go. Yes. Because I agree, social stigma Kant does not let them, go reach out to people to find out where should they go. This kind of okay, like that. But I hope दवा सिर्फ prescription based ही हो, है ना? ऐसे दवा नहीं देनी है. बहुत बड़ा मिसयूज होता है.
So we would like the judges to share a few kind words with the audience.
So all of you, we understand that it's a game show, but this is something that I, for one, do as a little deviation from my basic core speciality. So how an idea is to be, which is an idea that should be taken to the next level? How do you decide which idea goes forward and which idea has a worth and which idea you should spend your time on? So now it's a science, it's no longer an instinct. We think that, it's an instinct, I got a great idea and it should move forward. But then all of us at some point of time have great ideas. So how do you systematically and scientifically decide which is the idea that can go to the level of execution, commercialization, and so on and so forth? So there are a couple of set salient principles, and that most of these ideas that have to be classified as an innovative idea for commercialization have to go through. So first is that there should be a need of the idea. You should be addressing some need gap. Just a fantasy out of our mind is not. So for that, all the statistics, I think all the teams did an analysis of need, what need is there, be it the maternal, kind of psychological issues and mental health issues. All of you have done that. The second thing, this idea has to be unique, and that none of you talked about competition. What kind of apps are already available in the system? What kind of existing technology is available globally? Because if the idea is not unique, you would not be able to sustain in terms of protection of your intellectual property. If you give 2 years, then you decide that someone else already had that idea and already running, and the other person will have the first comer advantage, as well as they can block you by intellectual property. The second thing, it has to be unique. The third, it has to be feasible. You have an idea, but can you execute it to a level? You said that you're going to have nanny support services in India. Do you have the power to execute it in every city? So that feasibility needs to be considered. The fourth thing is that it should have a market. It may have a need, but it may not have a market. So until and unless an idea has a market, so a need and market are not always overlapping. So you have to see what kind of market is there. I'll give you an example. Suppose there's a very rare disease that requires a specific kind of device. Of course, there's a need for that particular person, but if you want to go for what is the market of that, the market may be like 10 devices in a year for a country, then it doesn't seem a commercialization and an entrepreneurship venture. And the fifth factor is, what is your differentiator in terms that how can somebody not replicate you? You do something and you create something nice, but then it's very easily replicable, and anybody who has the resources and who has the money outbeats you because he does it 10 times better, 10 times more resources. So what is your differentiating factor which others cannot have? So these 5 points, if you take into consideration, and that's how you develop your thinking of creating, from turning into an ideator to an entrepreneur. That journey has to begin with answering these 4 or 5 fundamental questions. Whether it's got a need, whether it's unique, none of them, whether it's in terms of patentable or copyrightable, whether it's feasible to do, whether there's a market to do, and how will you ward off future competition? What are your differentiating factors? So these 5 things, I feel, that's my point of view.
Thank you, sir. You said everything. This was a fantastic program. I was thinking that how Shark medical will work and how we are going to judge. But it was really a nice program, and as sir said, that the idea should be unique, and if a unique idea comes to your mind, one should have the copyright, because many a times it happens. I am a researcher, and many a times it happens that when you propose some concept and you give some proposal to the funding agency or anywhere else, for research purposes, at times it is not done, it is not funded, but after 1, 2, 3 years you get that the same proposal is accepted and it is there. So if you are going for some business, you should have these ideas. There were many ideas. It was very good to be here. Thank you.
Thank you. I congratulate all the team and all the members of the teams, all 7 teams. You all have worked very hard, done very well, very nice team coordination. Some of you may get the awards, some of you may not. But irrespective of the award, forget about it. I encourage you, each one of you have put so much of efforts. Please go back, find a mentor, get yourself mentored, get all these things refined, and try to take this to the whatever you want to do. Like, this is the ideation step, but how do you implement it? How do you ensure this progresses and really develops in what you want to do, execute it? So try to reach those levels. Don't go back and just forget you came here for Rhapsody, presented and finished. Don't just leave it at this level. Try to take it, irrespective of if you got the award or didn't get. So you have put a lot of efforts. That is the first stage. That is the most difficult stage to start. But once you have started, don't stop. All the best. Thank you.
So thank you very much. Thanks to the organizers for giving me an opportunity to be here once again. I only feel I don't have any other comment about this particular format and everything, but I wish these activities like the previous one actually, I should be struck off from the Rhapsody. You do clinical case presentations day in and day out. Anyway, no comments for that. But activity like this, where there is so much indigenous, expression, this should be done at a time which is not matching with the dance program there. It is really unfortunate that perhaps is the team which presented first, is it here or has it left? All the teams are here because I thought some teams have also left. Acha, okay. Because in between I thought there were less than the number of team presenters, because this deserves to be heard by more people. Even if you later on in the life do not go and do this job, but exploring this at this stage and the kind of
response you have shown is definitely worth an applaud. I wish there were more people to hear. This kind of activity should have more audience. So the organizers must make sure that these activities are done at a time which does not clash with the activities like this. See, when I was coming here, I also waited there. I came to know this is 10 minutes late, so I went there and watched the two dances for 10 minutes. If I had a choice, I would have been sitting there. So do not clash, because this really deserves to be heard by more people, applauded by more people. I wish there were more, seniors sitting here, and what a wonderful talent and what a wonderful way for them to go ahead is there. Congratulations for making all the effort.
Thank you organizers for having me here. It was really nice to see the wonderful effort you put into developing business ideas. And from the same theme, you all were unique, you all had something new to contribute, and that was really wonderful to see and hear. That usi idea or usi theme ko leke aapne brought it out in many different ways. I hope some of you are actually motivated to pick up other ideas and make them into true business ideas. Some of you have very valuable ideas, not necessary that you will win. That is also, because the winning has many components here. But the idea itself, Dr. Himanshu has been non-stop praising the maternal idea, maternal depression idea. So work on it. It need not, maybe not as a business model, but it could work into a research tool. It could be many other things. Keep the good job up.
Are you done? You are ready with your... Oh.
With great pleasure.
So, congratulations to everybody. So, the team which has come at the place of third is Team Tanav. Come in the front of the stage and then we'll call you up. Or are we calling them up right now? Okay, so Team Tanav, please come up. Have all of us in the group. Just hold this and just hold this, whosoever is getting it. So, Acha, oh, okay. So, yeah. All right. Make yourself visible for the pic. Make yourself visible for the pic. इधर आ जाओ, बैठो आप बैठो यहाँ. There. So the team which is at, okay, so the team which is at the second place is Momental, Rising Feelings. Is this the team which came from Allahabad?
Yes, ma'am.
So, okay, great. The name itself is very catchy. So good, very good. Are there number of books matching the number of participants?
We'll share.
Okay. Keep it in the common this thing and all of And the team which gets this trophy and the first position in this competition is Team Soma. So probably you nailed it by naming it Soma because Himanshu. So they're getting. And don't go and spend it on some Soma. Congratulations, very well done. Very well done.
Now we'd like to felicitate our sharks. First of all, to our chief guest, Dr. Uma Singh, ma'am. Next to Dr. Rishi Sethi, sir. Dr. Vimla Venkatesh, ma'am. Dr. Nishamani Pandey, ma'am. Dr. D. Himanshu, sir. Dr. Pooja Ramakant, ma'am. Next, I'd like to call Dr. Jyoti Vajpayee, ma'am, our teacher in charge.
Congratulations, you have participated very well. Now I would like to call Shikhar S. Gupta. Next. और कौन है? बड़ा वाला बुलाओ भाई सुभाजीत को। अरे ऐसा नहीं, पार्षद शुभजीत। Now I would like to call Dr. Subhajit Rai. Subhajit did a very hard work for this event to happen. So I would like to congratulate Subhajit and team. Shruti also participated very well and she did lot of work to happen this program. So I would like to congratulate Shruti again. Very well done, Shruti. These both kids are doing a lot of work, Shruti and